Excellencies, honorable guests, ladies and gentlemen, good morning, good afternoon, and good evening to all our participants today. My name is Julie Muyam. I am the Senior Program Officer at AAPAM, and it is my distinct honor to welcome you to this innovations webinar, focusing on disruptive innovations for people-centric service delivery. Innovation is one of the key pillars at AAPAM for the actualization of our mandate to enhance best practice, professionalism, and excellence in public administration. For the next 2 hours, we will be delving into award-winning innovations featured at the AAPAM Innovative Management Award that is held at an annual roundtable conference. Represented here today is a robust audience constituted of government leaders, senior officials, young professionals, private sector, sectorial experts, academia, practitioners, our friends and partners from other institutions, international organizations, NGOs, and all other communities of practice here represented. This shows that this discourse on innovation must be inclusive. And finally, as a formality, we invite you to interact with us through our chat feature, which is down there at the screen of the webinar function. And there's also a Q&A feature that you can also submit your questions and the panelists will be able to respond to them. There's also a reaction button that we also invite you to engage with us as much as you can. So without much further ado, it is my pleasure to invite the Secretary General of AAPAM, Professor George Scott, who will be making the introductory and welcome remarks. As an introduction, we'll mention that Professor George Scott is the current Secretary General of AAPAM. He is also an extraordinary professor at the School of Public Leadership, Stellenbosch University, South Africa. Before his appointment with AAPAM, Dr. Scott served for many years in the public service of Ghana in different capacities, including Chief Director, Permanent Secretary in various ministries. He served for many years as Municipal Metropolitan Coordinating Director for many localities in Ghana and as Director of Finance and Administration at the Office of the President. He has for many years been a part-time lecturer at the Ghana Institute of Management and Public Administration, GIMPA. Professor Scott has also been involved with the work of several international organizations, including the Guinea Current Maritime Ecosystem, the African Union, African Peer Review Mechanism, UNDESA, UNPAN, and including others. Professor Scott has authored many books, including several chapters in books, and co-edited 5 recently published AAPAM books. He has also contributed widely to international accredited journals and serving as a contributor and reviewer for academic curriculum for university courses and as an external examiner for doctoral examinations. Ladies and gentlemen, please help me to welcome Professor George Scott, Secretary General of AAPAM. Thank you.
Thank you very much, Julie. Our distinguished guests, partners, esteemed speakers, innovators, participants, ladies and gentlemen, on behalf of the African Association for Public Administration, Executive Committee, Council, Secretariat, and entire staff and fraternity, I welcome you to this morning's great webinar on innovation, which is under the theme, Disruptive Innovations for People-Centric Service Delivery. This webinar is a testament to our unwavering commitment to fostering and celebrating disruptive innovations that enhance people-centric service delivery across the entire Africa. We have gathered here today to explore some of the innovative, groundbreaking solutions that are reshaping governance, public administration, and service provision in Africa and beyond. The AAPAM Innovation Management Awards program was launched in the year 2005 to recognize innovations in the public sector through the introduction of new ideas and new operational and management methods. As a continent-wide program, which has lasted for over a decade, AAPAM Innovative Management Awards competition has served as a beacon of excellence and has recognized over 1,000 homegrown innovations from across the continent. Ladies and gentlemen, AAPAM has persistently spearheaded innovations through this Innovation Management Award, and this step has become essential for encouraging continuous innovation, celebrating creativity, and recognizing outstanding achievements in the public sector. It has also helped in providing visibility and motivation for government institutions to adopt innovative approaches. Last year, the year 2025, AAPAM's 43rd Annual Roundtable Conference witnessed the 15th AAPAM Innovative Management Award ceremony. At that ceremony, 5 submissions which merited the final stage and 1 special award that was focusing on a common African challenge were invited to make final presentations. This AAPAM initiative underscores the critical role of innovation in addressing Africa's unique challenges and advancing socioeconomic transformation. We in AAPAM family believe that innovation can be cultivated, it can be taught, it can be shared and replicated, and today's webinar is a step towards amplifying these principles. This year, as we prepare for the 16th Innovation Management Award at the coming December at the Roundtable Conference, we welcome as many submissions as possible. AAPAM has noted improvement of the submissions from 57 in year 2023 to 69 in year 2024. This was made up of 67 English and 3 Arabic, with 3 submissions from outside the continent of Africa. Ladies and gentlemen, this is important and also an important improvement in an effort on this Innovation Management Award. We therefore urge as many departments as possible to fully participate in this program for this year and beyond. The AAPAM Secretariat will inform you of the stipulated timelines and criteria for the innovation submissions very soon. Ladies and gentlemen, AAPAM recognizes the importance of structured platforms and therefore recognizes other programs aimed at fostering and sustaining innovative practice, such as that of the UN and the Public Sector Human Resource Managers Network. We inform you that the UN Public Service Award applications for 2026 is already on the website, and we encourage you to make submissions so that we can showcase the cases of AAPAM at the UN level. Ladies and gentlemen, innovation is not just about technology, it is about creating more effective processes, products, and ideas that drive meaningful change. From digital transformation in governance and grassroots solutions in undeserved communities in Africa, Africa has demonstrated resilience and ingenuity in tackling complex public sector challenges. The presentations we are going to make today are meant to remind and provide additional insights to further illustrate the pivotal role of innovation in achieving the aspirations of the Africa Agenda 2063 and the UN Agenda 2030 for Sustainable Development. Throughout this session, we will hear from past Innovation Management Award winners and distinguished experts who have pioneered impactful solutions in public service. We will examine key enablers of innovation, including leadership, stakeholder engagement, and sustainability, and how these elements contribute to the replication and scalability of innovative solutions across Africa. Ladies and gentlemen, I therefore encourage all of you, the participants, presenters, and experts, to engage actively, share their insights, and collaborate in forging a future where public sector innovation is not just an ambition, but a lived reality. Together, let us inspire, learn, and chart a path towards transformative service delivery that truly serves the needs of the people of our continent. Ladies and gentlemen, as we proceed with today's webinar, let us commit to actionable solutions and actionable strategies that would dismantle barriers, strengthen responsive governance, and foster environments where development and efficient service delivery can thrive. Through collaboration, advocacy, and policy innovation, we can turn our aspirations into tangible realities. Once again, ladies and gentlemen, presenters, experts, let me warmly welcome you to today's webinar, and I look forward to a very exciting and stimulating and enriching discussions. Thank you and wish you all the best.
Thank you so much, Professor Scott, for that welcome address. I think you reiterated the cardinal importance of innovations in addressing some of the prevailing challenges in public administration, noting the enablers of innovation, such as leadership and technology as a lever for enhancing innovations, as well as creating a conducive environment which innovations can thrive. Furthermore, in his address, he has reiterated that AAPAM shall be announcing the 6th Innovative Management Award program, which shall be conducted at this year's Roundtable Conference. So by the end of this webinar, we shall be giving further information on how to submit your applications for the IMA program, as well as the United Nations Public Service Innovation Award that will be closing on the 31st of March. So we encourage all countries to submit their innovations to the United Nations level as well. Thank you so much, Professor Scott, for setting the stage for this webinar, and we shall move on in the program with our next speaker. Our next speaker will give us the keynote address, showcasing innovation in focus. And our speaker is His Excellency, Professor Dr. Saleh El Sheikh, the Vice President of North Africa. First of all, we want to wish a Ramadan Kareem to all our Muslim brothers and sisters as they join us for this webinar. And we look forward to hearing from Dr. Saleh. Dr. Saleh is from Egypt, one of the countries that has really spearheaded innovations within the African country. So it is our pleasure to invite Dr. Saleh. Dr. Saleh, as mentioned, is the president of the Central Agency for Organization and Administration, CAWA, which is based in Egypt. He is at the rank of minister and a tenured professor of public administration at Cairo University. He serves as head of the Civil Service Council of Egypt, as well as serving in other capacities within AAPAM, such as being the Vice President, North Africa. Professor Saleh holds a PhD in public administration from the Western Michigan University and has previously served as Vice Minister of Planning, Monitoring, and Administrative Reform. He is a member of Egypt's Supreme Committee for Administrative Reform and the African Peer Review Mechanism Commission. Professor Saleh has held leadership roles in various organizations, including Cairo University and Future University in Egypt, and has served as consultant for various international organizations, including UN Women. He has also contributed to several government committees on administrative and civil society reform, decentralization, and local governance. Professor Saleh, an expert in public administration, has participated in numerous international conferences and published research on administrative reform, decentralization, and gender budgeting. He is also a supervisor for PhD and master's theses, shaping the next generation of public administration. With that introduction, it is our pleasure to invite His Excellency, Professor Saleh, to make his introductory and keynote address. Over to you, Professor Saleh. Okay, I see that the Egyptian team is trying to reach out through Ambassador Ashraf, so we shall be getting back to them. But in the interest of time, we'll request that you move on to the next session, and then we'll come back to the keynote address from Egypt. And in that note, we shall introduce our report analysis and discussion segment of the program, focusing on the 2024 Innovative Management Program. And this will be led by our able jury. Our jury members, led by Professor John Mary Kauzia, the chairperson of the jury. I will allow him to introduce himself and then introduce the speaker for the jury. Professor John Mary Kauzia, if you would do me that honor, please.
Yes, thank you very much, Julie. Good morning, good afternoon, good evening, everyone.
Good morning.
Let me start by congratulating the Secretary General of AAPAM and his entire team for organizing this interesting webinar. I'm John Mary Kauzia. I'm a professor extraordinary at the School of Public Leadership, Stellenbosch University in South Africa, and I chair the jury of the AAPAM Innovative Management Award. I think the presentation will be made by my colleague, who is the secretary of the jury, Sam Macharia. I haven't checked the participants. I don't know whether he's around. I hope he is around. As you probably know, the jury is made of 7 people, and that is myself as the chair, and Mr. Samuel Macharia as the secretary. So Dr. Hanan from Egypt, who is the vice chair. I think I'm going to leave the introduction of the rest of the panelists to the moment when they intervene after Mr. Macharia has made the presentation of the report as we discuss it. I think that will save us some time. So, Sam, I can see you are very much available. I think I give you the floor to make the presentation. Thank you very much.
Hello, Mr. Mashari, can you hear me?
Mr. Masharia, can you hear us? We seem not to have you. Professor Kauzia, would maybe another teammate from the jury want to take over the jury report, or should we move to the next one and then come back to Mr. Masharia? Do not seem to have a jury ready.
Wouldn't the next be the discussion of the report?
Yes, but we can push this also to after the presentations have been made, if Mr. Masharia is not yet ready. I can see him here. Maybe you unmute yourself, Mr. Masharia. Okay. Mr. Masharia, if you can hear me, you need to unmute your microphone so that you can begin your presentation. Is that okay? Okay, so I think in the interest of time, we shall just move to the presentations, and then we will do the keynote address from Egypt and the report from the 2024 Innovative Management Award last. Please forgive us for these technical issues that seem to be coming up. So at this presentation section, it is my pleasure to invite my colleague, Mr. Clifford Ogutu, to take us through this section. Clifford, you have the floor. Thank you.
Thank you so much, Julie. Greetings to all protocols observed. My name is Clifford Ogutu, as indicated by my colleague Julie. I'm going to take us through the next session, which you're going to now listen from our distinguished panelists who are the IMA winners from last year. The first presenter is going to be His Excellency the Governor of Murang'a, Honorable Irungu Kang'ata. Is going to take us through the session under Kang'ata Care, Universal Healthcare Coverage. It is the award that won the gold medal during the AAPAM Roundtable Innovation Management Awards. You'll allow me just to briefly read a short bio of His Excellency the Governor. Governor of Murang'a County, Mr. Irungu Kang'ata, was elected in 2022 after serving as a senator and majority chief whip in the Kenyan Senate. He previously represented Kiharu constituency in parliament and was a county assembly representative. Holding a PhD in law from the University of Nairobi, he taught law at the Catholic University of Eastern Africa. Since becoming governor, his policies have received national recognition for their impact on local communities. His leadership is widely credited with bringing transformative change to Murang'a County and beyond, hence enhancing governance and improving public service delivery. With those few introduction, I now take this opportunity to welcome His Excellency Irungu Kang'ata to take us through this session. Most welcome, Honorable Governor.
Distinguished guests, ladies and gentlemen, I'm not His Excellency the Governor. I'm Edward Mwangi representing him. He was really willing to make the presentation, but he got engaged in a certain critical activity. So he requested that I make the presentation on his behalf. I'm his chief officer in charge of public administration. So I'll be making the presentation, and allow me to first thank AAPAM for the opportunity, for giving us the opportunity to be able to showcase and to present this innovation that we have implemented and that is really bringing a lot of social transformation in Murang'a County and even attracting a lot of interest based on the change and the transformation that it is bringing. The initiative is called Universal Health Coverage, targeting the indigent and the vulnerable persons in Murang'a County, but it is popularly dubbed as Kang'ata Care. And for us to start, I would wish we start with a short video so that we may see the journey of the whole program. So Clifford, if you can be able to play for me the video, I would really appreciate it.
The Kang'ata Care Program is an innovative healthcare initiative by Murang'a County Government that has enabled the county to provide healthcare services to the most vulnerable individuals and households of the Murang'a community free of charge.
Wakati Kang'ata Care ilipokuja imetusaidia sana kwa sababu hatusumbukangi, tukipatwa na shida inatusaidia.
With a current enrollment of about 160,000 beneficiaries, the program provides the following healthcare services: comprehensive healthcare coverage, telemedicine, mobile dialysis, ambulance services, treatment abroad, rehabilitation, and the last respect expense, among others. To ensure no one is left behind, the program targets the most vulnerable people in the community, such as the elderly, orphans, people living with disability, and those with terminal illnesses such as cancer, HIV, and diabetes, among others.
I've been a member of Kang'ata Care since 2023. I had a chronic illness. I was operated at the Kenyatta University Referral Hospital. After the surgery, my bill was 70,000. Kang'ata Care paid the full amount. Thanks to Kang'ata Care, because now we don't do any fundraising to cater for our medication.
For proper identification of its target groups, the program uses a proven scientific metrics as a criteria for selection, community leaders and the existing government structures for validation.
25 once a day.
In telemedicine, there are currently 15,000 registered patients receiving services across the county. Through the use of ICT, 38 out of 157 registered health facilities are connected to the specialized doctors virtually for consultations, prescription, referral, and e-theatre. For instance, at Kriaini Dispensary in Mathioya constituency, we meet Jennifer Mumbi, a 58-year-old resident receiving her regular free consultation services for a chronic illness. Through this technology, Jennifer no longer travels long distances to seek for medical experts.
Hii Kang'ata Care mimi inanisaidia sana juu nilikuwa mgonjwa sana, nikatoka hapa nikaenda Kagema wakanituma Murang'a na nikaenda huko nikafanywa x-ray ya mgongo na hapa hivi na ilinilipia pesa yote, hakuna kitu nilipa, ni basi ya tu nilitumia. Na wakati huu siendi Murang'a na kuja hapa kwa daktari wa medicine. Ukikuja hapo unamwelezea, na kwanza nilikuwa napewa dawa nyingine, miguu ikafura, nikakuja hapa juzi kanibadilishia dawa, sasa niko sawa.
And in Gatanga constituency, we meet Michael Gushu, one of the patients with kidney complications, walking into a mobile dialysis truck at Gatura Healthcare Center.
Beleni, kabla hii lori ya Kang'ata ikuje, nilikuwa naenda mbali sana, nilikuwa naenda mbali inaitwa Keno Hospital. Kutoka hapa nilikuwa nikilipa zaidi ya 300 kwenda na kurudi 300. Kang'ata Care imetusaidia juu iko na truck ya dialysis. Inakuja kwa hospitali, inakaa hapo. Wewe unaenda unatibiwa karibu na mahali huko. Hakuna fare unatumia. Kama mimi sasa natumianga 30 bob. Kutoka kwa nyumba kukuja hapo kwa hospitali na kurudi natumia 60 bob. Kwa hivyo mimi nasema hii Kang'ata Care imekuja kusaidia wale watu wanyonge, wale hawana kitu.
This has not only reduced the cost of travel significantly for patients, but it has also brought the much-needed help closer to the people who need regular dialysis services. With a poverty rate of 26.7% in Murang'a County, the Kang'ata Care Program is also providing the Last Respect expense as a service for free.
One very important program that has been running with Kang'ata Care is the Last Respect expense. You know, death of a person and burial is very taxing to the family, especially if they have children in school. 1,000 families have benefited from this. It has been very, very key in supporting the bereaved families.
For instance, in Mjini Township Ward, we meet Winnie Washera, a 43-year-old mother of 4 and a beneficiary of the program. She recently lost a family member, and as a result, she directly benefited from the scheme.
Vile brother yangu aliaga tu, hii kadi ilitusaidia juu ilitupea 100,000 hapo. Alafu tena madeni tulikuwa tunakopa to and fro, tulikuwa tunalipiwa tu na hii kadi na hakuwa wanahesabu.
As a result of the Kang'ata Care Program, provision of healthcare services has improved through automation, and the county has realized an increase in revenue collection. And to ensure that the program remains sustainable, the revenue collected is being used to equip hospitals and clinics across the county with solar energy while building the capacity of the staff in the hospitals. Due to the success of the program, other counties and countries have visited Murang'a for benchmarking. These include the Kingdom of Eswatini, Uganda, Nakuru County, and Mombasa County, among others. Kang'ata Care, an award-winning innovation in healthcare.
So thank you, Cliff. You can allow me to share my presentation. So thank you. As you have seen, that is the program, Universal Health Coverage, that is being implemented in a place we call Murang'a County. For those who may not be having much information maybe about Kenya, is that Murang'a County is one of the county governments, one of the 47 county governments that is in Kenya. We have 47 county governments, with Murang'a being one of the county governments. And Murang'a County in itself has a population of over 1 million Kenyans, which constitutes, or it translates to 2.16% of the total Kenyan population, with the Kenyan population being 51 million. And when you talk about Murang'a County, is that Murang'a County, in terms of the poverty rate, we are having over 340,000 Kenyans listed to be living below the poverty line, which is 30.1% of the population in Murang'a County. And within that, we have those ones who are living absolutely over 160 in abject poverty in Murang'a County. And in terms of even the expenditure, is that many of the homes, many of the people in Kenya, they're incurring a lot of expenditure in regard to health, both at inpatient level and outpatient. And even as they incur that, is that when you come to Murang'a County, as per the statistics, is that over 70% they are not covered, or they are not having any medical scheme that can be able to cater for them, meaning that when they face health issues, whether at the level of inpatient or outpatient, they are forced to cater that from their pocket or from the little that they earn, simply because they don't have a cover that is covering, or is a medical cover to really cater for their medical expenses. And for even those ones who are having a medical cover, the 30% who are having a medical cover, within that, you go and you realize that there is a percentage that we can rightly say like it is disenfranchised because it's not considered for the medical covers or they are excluded. And this includes the elderly, such that majority or the routine medical insurance providers, they will not cover the people who are really aged or who are even beyond 60 years. And even if they do, the cost becomes very, very high. Similarly, the people who have chronic illnesses, terminal illnesses, the people who are disabled, the people who could be having HIV, at times getting a cover, even within the 30%, it becomes quite a big challenge. And when this population is left out, this population then ends up on eating on the resources that even those who have resources have, because they'll have to cater for these poor people. And that is why this Kang'ata Care or this program came up, and our governor, His Excellency Dr. Irungu Kang'ata, came up with this idea so that he can be able to help, or a program that will be able to cater for these left behind, for this category of people who are usually not considered, these people who are having chronic illnesses like cancer, diabetes, kidney complications, these people who are elderly, to the extent that even the cover covers, there is no limitation of age. Whether you are 100 years, you are 20 years, this cover actually really targets you. The people who are disabled, the people who are orphans, this cover came up so that it looks at this vulnerable population. So it was introduced with a view of looking at this category of people, this category of population who are left out, who are not considered by even the mainstream insurance providers, or who there will be a lot of hesitation simply because these are people who can be, their predisposition to illness is extremely high. And that's why the profit-making insurance providers may not be willing to cover those. But this cover came up so that is able to cater for these people. And when this program, which was conceptualized and implemented in the year, it was conceptualized in 2022, and it started taking effect in 1st of January 2023, it was aligned and it was anchored on several areas. One, it is definitely anchored on the SDGs, the one that talks about the good health and the well-being of people, and also the African Agenda 2063, goal number 3, that addresses healthy and well-nourished citizens, and even the Constitution of Kenya, which talks about, having health, good health for the people. It's again also anchored on the governor's manifesto before he was elected. This is what he did research. He did a lot of research and realized that there is this category that is left behind. And therefore, in his manifesto, he put it forward that he's going to implement that universal health coverage that will target the indigents and the most vulnerable. And after that, when he came into power, a policy was developed, and this policy came up so that this is anchored on that policy. And the policy was definitely passed by the local county assembly so that the whole policy and its implementation and funding is anchored on law. And this cover, or this program, having said the people that it covered in terms of the vulnerable and the indigents, it has within it an inpatient cover, an inpatient limit, such that the people covered, and it covers a principal and 4 beneficiaries, with the current actually having 160,000 beneficiaries covered. And they get the benefit of an inpatient cover with a USD limit of 100. And this limit covers a lot of issues: the hospital stay, the procedures, the treatment, specialized doctors, the nursing care, and everything related to inpatient. There is also the outpatient, which is also covered within that. Then it goes beyond to have a dental and optical cover for this population. And it also has rehabilitation and treatment of mental illnesses, as well as treatment abroad, and also offering emergency evacuation and ambulance services. Over and above that, there is the last expense in terms of if any of the beneficiary passes, the family is given USD 770 to be able to defray the funeral expenses. And even now, also the issue of the maternity. Upon partnership, even with the private sector, the program has introduced also an added benefit, and these added benefits are there to cater for some of the issues that may emerge. For instance, school fees, that the cover is now offering school fees relief on the death of a principal or the spouse. In case they have children and they pass, there is a relief that is usually given, and even to encourage, the issues to do with the weddings and childbirth, there is also a package that is provided to them. In terms of enrolling members to this scheme, the first thing that I've said is that there is the target population. And that's why there is a general criteria that has been set, to the extent that this general criteria that has been set is going to bring up the people who mostly are in serious need. And there is a scoring template that is provided, to the extent that the one who gets the highest score gets in the list of being considered. For instance, if someone is having some mental illnesses, there is a higher score that has been allocated on that. Like cancer being allocated 40 marks, kidney 40, and all the other, the way, the mental illness constituting very, very high marks, such that if someone then is having a chronic illness, then that person is at a better position to be considered for the program. Then the dependents. The dependents, it means that how many number of dependents does one has. The more number of dependents that someone has, and in this case, we are not just talking about the immediate. We are talking about even the dependents that could be left. For instance, this is an old person, has been left with the children of his or her children to take care of them. So the number of dependents, the higher the number of dependents, the higher the marks that you are going to get. And even the age, you can look and see that if you are aged 80 years and above, then you get higher marks. If you are aged 50 years and below, you get lower marks. Then the aspect of disability and the orphans. Once you get the list of the people that are going to have the higher scores from that list, the second thing, and remember, as this has been done, the community leaders are involved so that they're able to ascertain that indeed these people are in need of it. The religious leaders, the community leaders, they are engaged to ascertain how these people are in need of that. But after that, then these people are again subjected to the normal processes of ascertaining if indeed they have a cover. For instance, if someone is having a current medical cover with a private institutions or elsewhere, then that person does not get considered. So we use the current systems, we subject the people who are going to have the highest score, we subject them to that scrutiny, so that again, we are not giving someone who is already having another medical insurance cover, and we are now again giving them this cover. So it only covers the people who will not have that cover. And this does not just happen in a particular place. The whole recruitment happens across the whole of Murang'a County, in every ward, in every place, and there is equal distribution and equal allocation of slots, such that in a particular, every place, and in terms of the jurisdiction, they allocated particular number of people to be considered. And therefore, the people who are going to have the highest score, and it's going to be ascertained that they are not having any medical scheme, they are going to be considered. This program has brought a lot of benefits. One, the issue of defrayment of medical expenses, it has really reduced. I mean, it has really brought a lot of advantage to to these people who are vulnerable, who are indigent. They no longer had ways of being able to cater for their medical, but now we are able to defray those medical expenses in regard to whether it is inpatient, outpatient, optical, dental, or even the last expense. We are able to defray the last expense, to defray expenses incurred during the burial, something that has really brought a lot of, a serious contribution, because as we all know, is that death in African setup is taken with a lot of weight, with a lot of cultural weight. And therefore, when these people who die, they are buried in honor, it brings in a lot of value, it brings in a lot of honor. And therefore, this has brought a lot of value to the beneficiaries, such that even if someone, any of the beneficiary passes, they no longer have any fear because they'll be able to meet the burial expenses. One other advantage also, because when this program was introduced, there was the need to bring in a system. There was the need to automate. There was the need to follow up, to be able to know, because we have recruited people across the county, which is very, very expansive. There was need then to follow up, to get to know how are these people getting attended? What are the common ailments that these people are getting, which is coming up from these people? And therefore, a system was established, and this system is able to monitor not just the revenue, but also the number of beneficiaries who are going to the hospital, who are getting attended to, and even the common ailments that are arising from these beneficiaries. And over and above that, the system that has been introduced has been in a position also to look at even the issues to do with the medication, that these people are going to hospitals, but are they getting medication? So that if they're not getting medication, then we are able to equip the hospitals with the common or with the medications that they so require, so that at the end of it all, these people, remember, who are also aged, you don't want to subject them to long distances. You would want them to access medication at the nearest facility. So automation has really made a big contribution, to the extent that it has even impacted on the overall county performance on revenue collection, almost doubling the revenue collection. Then the other thing that was realized is that some of these patients, they are located in the rural areas, in very, very far away places. And these people, at times, based on the perspective that we have limited resources even to employ doctors, therefore, these people were forced to come to the level 4 hospitals and the level 5 hospital. So they are still forced to travel distances as they go to seek for medication. And that is why, through the program, then the initiative introduced the telemedicine whereby we have installed telemedicine equipments in those facilities, in those health centers, where these patients can be able to go to the health centers, but they can be able to get consultations from consultants, from specialists who have been stationed in a particular center that we have established, of having the consultants. They sit there and they are able to attend to these patients. So the health center will only be able to take the basics in terms of the triaging of the patients, but everything else, the patient will be able to be attended by a doctor sitting somewhere while they're sitting almost next to where they come from. So they don't need to travel long distances. The telemedicine, and for now, we are recruited 15,000 out of this whole population, and we are in the other phase of recruiting more so that they can be able to be attended. And we have already 38 health facilities installed with these telemedicine equipments, and has been enrolled in those arrangements. The other thing is that we realized in Murang'a County, chronic illnesses are quite common. And some of these chronic illnesses in Murang'a County is like the kidney complications, the diabetes. They are very, very common chronic illnesses in Murang'a County. And that's why through this program, we realize some of these beneficiaries, they are having kidney complications, and they are therefore forced to be going for 2 to 3 times in a week to attend to dialysis in a facility that could be very, very far away, and therefore incurring a lot of cost. And so with that, we have introduced mobile dialysis trucks. We have introduced mobile dialysis trucks. We call them Murino Roads, through the partnership with the partners that we are working with. And these dialysis trucks, which are having like 3 dialysis machines, they are able to move station by station. So we queue patients in a particular place. We know the patients who go for dialysis, we queue them, and these patients are able to go to dialysis in the nearby health center. So they don't need to travel long distances as they go to look for, as they go for dialysis machines. The other thing is about placement. We realize that these patients, again, they may need to travel for long distances as they go to health centers, as they go to facilities that have adequate all lab equipments. And therefore, we have introduced placement arrangements. And this placement arrangement is about having lab equipment installed by the partners in the various health facilities so that patients don't have to travel long distances. Over and above that, to ensure that these patients, remember, who are aged, who are having chronic illnesses, so that you also reduce on the expenses incurred and even target entirely in terms of traveling long distances. We have also introduced a system that we are calling the sample referral mechanism, whereby in the next facility, in the next health center that is next to them, the sample can be picked, the sample can be collected, and we have what we call popularly here in Kenya, the boarders or the motorcycles that are equipped with very good equipment. They are able to collect samples, take them to places that have adequate lab equipment. The samples, the lab people do whatever they are supposed to do, and the results are relayed back through the system, through the automation, through the automated system. They are relayed back to the patient at the health center, which is next to where they stay. So they don't need to travel, that I have to travel long distances for me to be taken certain samples. So that is something that we have done. Over and above, even adding other equipments like dialysis machines. Currently, we are introducing an theater whereby operations will be undertaken under guidance of senior consultants at wherever they could be, whether it is in Nairobi or wherever they could be, so that we reduce the cost incurred by these patients. Something else that this program has introduced, when we are doing that, remember, we are doing it even in very remote places where electricity is an issue. And even if it is not an issue, the cost incurred with electricity at times can be quite discouraging, to the extent that these people, the cost incurred could be very, very minimal, but the other operational utility costs could be high. So one of the things that we've done is to ensure that we solarize our facilities. And in fact, for now, we are headed actually to 80 facilities already have been done solarized. We are using solar, and we have removed them from the main, the electricity, the main electricity, so that it doesn't matter whether they have electricity, it doesn't matter whether there are fluctuations of power. Power is there because there is solar, so that the systems flow without any disruptions. Then something else within the group, remember, one of the criteria you saw is that the people with disability, they also have a higher advantage of being considered. And therefore, the people with disability.
But summarize E.
Okay.
Summarize
yes.
Akimaliza, and then unaweza niita alafu niendelee.
So we have enabled the people who are disabled, and every year we have a function that we always arrange to ensure that all the people who are disabled, who are in the program, and even extending to those who are not in the program, we are able to empower them by giving them rehabilitative equipments, maternal support. We realize that the people within the program, especially those who are enrolled, at times they may not have support in terms of their maternal. And this, I mean that, yes, you could be in the program, but the cover will cater for your maternity, the point of delivery. But there are other things that you need to do before delivery. There is the prenatal and the postnatal. And therefore, the program has introduced an incentive whereby people who are due for pregnancy, they are paid certain amount so that it is encouraged for them to go to clinic. And then if they deliver at the hospital, they are paid, definitely the bill is paid for them through Kang'ata Care. And over and above that, they're given some money to be able to encourage them to be going for the clinics so that we are able to reduce both maternal and infant mortality. Infrastructure is something that you've done. So many hospitals we have built, so many health centers that we have been able to build, the nutritional program associated with this. These are people, remember, some of them didn't have money. They were very poor. They didn't have even enough cash to cater for their, for their dependents. And therefore, through this program, we have also introduced what we call a LOGI program, whereby all the children who are going to, to what we call the early childhood development centers, they are provided for free with what we call porridge, nutrition porridge, so that they are able to be encouraged to go to the schools. Why is this program sustainable? One, the program is anchored on health policies, I have said. Number two, there is continuous allocation of money by the county assembly, the county assembly's continuous allocation of money. And then through the program and automation, the county has seriously increased its own revenue. And this revenue is put back into this program and other program, associated programs, into improving the infrastructure. And over and above that, let's note that this program, because it is based on an insurance mode, is that when I go to the hospital and I have an inpatient limit or outpatient limit or dental, the hospital charges, and when the hospital charges, the amount in terms of the premium, the amount incurred in the medication is again paid back to the facility that offered the service. And that's why we have improved our health facilities so that they are able to offer all these services. And when they offer the services, the money is paid back. Remember, it's not, this is a program which is anchored previously. It was under the National Hospital Insurance Fund. Currently, we are calling the Social Health Insurance Fund, which is the SHIF. So adopting the insurance modality, the money is paid back. So a lot of money is paid back to the county health facilities. And this plowing back of the premiums makes the program quite sustainable, to the extent that you only require to allocate a very small percentage of amount from the budget to be able to make the program continue. So that is one thing that makes the program quite sustainable, because money is being plowed back. The people going to dialysis, they will no longer go to the private health centers out there. They'll go to they go to our health facilities, whereby we have improved all these equipments by almost 80%, and therefore the money will be catered, the money will come back, and the money now will only make the program continue to grow more and more. So interest has grown. The Kingdom of Eswatini, they came to just see how this program is being run. They came under the recommendation of the national government, because it's a unique program that no other county, no other entity has implemented. Those ones that have tried the universal health coverage, yes, they have, but not to the extent of catering for the vulnerable and the indigent. And so the national government recommended that the Kingdom of Eswatini comes back to see how Muranga is doing it. And even Uganda, the Ministry of Gender, Labor and Senior Citizen Social Development, they were also referred to the county to come and see this program and other child-related programs that were running, or that the county was running. Across the county, many county governments have come to see how the program is running. Very many, they have come to see, to the extent that even as late as early this month, the governor of Kisumu County came to be able to benchmark and see the mobile dialysis, so that he can be able to implement that. And he committed that he'll be able to implement that within 2 months in his county. Recognition, definitely the program won the AAPAM Gold Award for its innovation in terms of thinking for the indigents and the vulnerable persons. It also won overall among the 47 counties. The program was recognized as one that is really impactful, and that one that is really advocating for the devolution of services, that is really advocating for the people who are left out behind. And so it was awarded with what we call Kifaru. And even the recognition, very many recognitions, to the extent that even last month, the Excellency, the Governor, Irungu Kang'ata, was awarded as the best governor in the country, simply because of this program and other programs, and the impactful nature that this program is having. What are the challenges? Definitely they have been there. The equitable share, the amount that we get from the national government, but which we are trying to counter by growing our own source revenue. The unreliable internet, definitely it was there, and power, but which we have really adopted means of trying to counter that. And even the need to increase very many people. So many people are now getting interested to join the program. What are the lessons learned? One, we have learned the issue of partnership is very, very critical. We are not doing this just on our own. Majority of these programs, like the telemedicine, this mobile dialysis, we are working with partners. Like the mobile dialysis, we are working with a partner, the health decks, all these partners, the Bion 8, we are working with partners. The equipment placement, it may be difficult to make on your own, but when you work with partners, but again, you have very good leadership that is very responsive to the needs of the society, leadership that is really actually focused on transformation, that is focused on the common good as opposed to individual good, then you're able to attract a lot of partners because they can see that your focus is the people, your focus is not your self-gain. So we have a lot of partners who are interested to the extent that we are even going to enroll another partner to be able to be running drones. And then another thing is that health is seriously a major driver of economy. Why do we say that? Because the moment we did this, the economy, it may not be explicitly tangible, but the effect is very, very, very high. To the extent that these people, we have saved them a lot of money, a lot of cost that they were incurring before, and they are able to put that back into into other economic gains. This is even evidenced by the fact that initially there were a lot of things that we usually call in Kenya Harambee, bringing people to contribute for the sake of a certain person, maybe who has faced a certain illness. These ones have greatly reduced. Our hospitals used to be having a lot of requests for what we call waiver. Someone has come to the hospital and they have incurred a lot of costs they are unable to pay. Right now, the waivers have reduced almost by 80%. And then utilization of local resources, that it is possible to use the local resources as long as you use them very well, as long as, the governor is not a medic. The governor is not a HR. The governor is simply a lawyer. But the governor is using even the local resources. The governor is using the people who are there, and these are the people who are giving the ideas. And for him, it's just to shepherd. So it's possible to use the local resources. For the automation, we have used our young people. We recruit young people even at the point of interns. We give them incentives to develop systems. They give the best systems. When they give the systems, we give them the employment. And that has really enabled us to work. That has really enabled us, even Murang'a County, to shine. That has enabled us, Murang'a County, even when you check across the internet, to be able to offer the best services to the people. Thank you very
Mr.
much.
Edward, you have 1 minute, kindly. Thank you. Oh, I think you have finished. Thank you.
Yes.
Thank you. Thank you for that presentation. We appreciate your presentation, and will just allow me to briefly give a recap of your presentation that you have just done. Following the presentation by Mr. Edwards, he has noted that Kang'ata Care is a universal healthcare coverage targeting the vulnerable people in Murang'a County, mainly the elderly. And this medical care, it has been able to be implemented in over 160,000 households in Murang'a County. And he has noted that the package includes outpatient and inpatient services, which are rolled out in various contracted medical facilities within Murang'a County. And one thing that has really attracted me, or that has caught my eye, is on the implementation of telemedicine in Murang'a County. He noted that it is the only one in the country where patients are able to receive virtual consultations in the county, and doctors are stationed, and they are able to offer consultations to individuals from their place of residence, and And it just shows how technology has enhanced healthcare and access and made healthcare accessible to various people in the county of Murang'a who are vulnerable and are not able to go to hospitals directly. So this is one of a kind, and I think it will be important just to see how it is replicated across the country, in Kenya and even beyond. And also another aspect was on the issue of mobile dialysis trucks, where individuals who are having various chronic illnesses are able to be visited by these medical mobile trucks, and they are able to get various medical assistance. And from your shared presentation, we have just seen the interest that this initiative is attracting in the country, and even with outside the country is interesting, and it just shows how it has revolutionized healthcare in Murang'a County and beyond. And we want to congratulate Murang'a County for leading in this aspect and ensuring that it is offering service delivery to the people. We thank you very much on behalf of the governor, and we'll just hold it there, and we will have questions and answers after this session. Allow me to invite my colleague Julie briefly, who will take care of the next session, after which I will take over. Thank you very much. Julie, most welcome.
Thank you so much, Clifford, and thank you to Murang'a County for that insightful presentation. The passion is evident from the presentation. Ladies and gentlemen, as mentioned earlier, we will take a short break from the program and head over to the presentation from Murang'a County. But we're glad that we have our friends from Egypt joining us, as well as the secretary for the jury. So allow me to just maybe take back the program to track and invite our team from Egypt. Again, we wish our Muslim brothers and sisters a Ramadan Kareem, and we look forward to having the presentation from Egypt. Allow me to go through his bio again, as I had earlier read, but please allow me to do this in his presence. So His Excellency, Professor Dr. Saleh El-Sheikh, is the president of the Central Agency for Organization and Administration, CAO. Yes, please.
Yes, I already heard this. This is wonderful introductions. So I would like to save your time, okay? Thank you. I really appreciate. I really appreciate.
Okay.
I really
Without much further ado, you're welcome, Prof. You may take the floor.
Thank you so much, and always nice to see you, even online. Good morning, ladies and gentlemen, distinguished guests. It's an honor to stand before you today to share insights on a very important topic, which is innovation. Innovation not only has a great impact on public administration, but rather shapes the future of the world. Innovation is not just a new technologies. It's a mindset, a journey, and a commitment to continuous improvement. Today, I will take you through a reflection on the impetus for a change, the lessons we have learned, and how we can ensure the sustainability of innovation in a rapidly evolving world. Many believe innovation begins with an idea, and of course, they are correct. But others think it begins with a challenge. The most groundbreaking innovations emerge not from comfort, but from necessity. Throughout history, we have seen that every major advancement was driven by a pressing need. According to Arnold Toynbee, which he's an English historian, he explains why the Industrial Revolution, the first industrial revolutions, took place in England, although they don't have what it takes to do so, and not in Germany, not in France. As a matter of fact, he explained that by the theory of a challenge and response. As public sectors worldwide rapidly transitioned to online services and remote work, and lots of mechanisms that have been introduced by these new technologies, studies indicate that most public service providers adapted to remote work, with many finding it a normal practice. Believe it or not, in our agency, currently we are taking Tuesdays working from home. Why Tuesdays? This is in the middle of the week, just to avoid long weekend. And with the long weekend, according to studies, workers and employees, take more time to warm up and to get back to work. Innovation is essential for reforming and modernizing public administration, especially due to budget constraints and the need to engage citizens in policy formulation to promote transparency and participation in key areas. The United Nations 2030 Agenda for Sustainable Development calls for transformation through enhanced creativity and innovation in the public services at all levels of governance and public administration, through advocacy, empirical and analytical research, as well as leadership and human resources capacity development. In 2005, the United Nations General Assembly agreed that the United Nations should promote innovation in government and public administration and stressed the importance of making more effective use of the United Nations public service. The United Nations Public Service Awards program was launched to promote and support member states' efforts to improve public sector performance, through which advice, research, and capacity development in the public service, as well as creativity and innovation, are promoted among public sector leaders, human resources managers, and public events. Likewise, at the AAPAM, as His Excellency the Professor Scott mentioned, also we have the AAPAM Innovation Award. Also was launched, almost at the same year. The second goal of the African Agenda 2063 is aiming at well-educated citizens and the skills revolution underpinned by science, technology, and innovation. And across Africa, we have seen remarkable innovations that are reshaping public administration and public services. Countries like Rwanda, Kenya, Ghana, Tunisia, and Egypt, just to name some of our 54 countries, have introduced digital platforms for government services, making it easier for citizens to access permits, pay taxes, and register businesses without unnecessary delays. In Egypt, we have a strategy for innovation in public sector, and we have also a strategy for AI that led by the Ministry of Information Technology. Also, we established a department for ethical usage of AI inside this ministry. Also, we have, modified and amended the civil service law. Currently, the civil servants, they can innovate, they can create whatever they want. And this is we have to recognize these innovations, and it should be in their records. But this, whatever they produce because of the work and at the workplace, this is the ownership of the workplace itself. Again, we have to recognize their efforts. We can pay for them, but this is the ownership for the workplace that created this because of. It's very important to say that AI is being used to improve service delivery. Egypt has adapted AI in some departments to improve the public administration. For example, we have Kemet. Kemet, this is the chatbot with the AI, which is supported and supervised by CAWA and helps all civil servants. In Kemet, it's already available on WhatsApp, on the official website of CAWA, and also on the Facebook and all social media platforms. Anybody has questions about the civil service law, they can get 24/7, and they will get answer right away by talking with Kemet. Kemet answers and contact verbally, orally, and also in writing. And Kemet stands for a knowledge management transfer tool. So Kemet can answer your questions, whatever you have in your mind, without any delay. That's why we call it, this is the first digital civil service, the first civil servants servant in the Egyptian public administration. African governments have recognized that innovation cannot happen in isolation. Collaboration with the private sector, academia, and civil society has led to the creation of solutions that improve service delivery. Again, governments cannot work alone. Governments cannot work alone. These initiatives is an evidence that Africa is not just adopting innovations from elsewhere, it's creating its own solutions tailored to the unique challenges. If we have a look at the mega IT companies all over the world, you will find lots of our African fellows working there and leading the innovation. Notably, every innovative journey is marked by success and failure. Here are some key lessons we have learned. Failure is a stepping stone, not a dead end. Many innovations that changed the world were built on failure. Thomas Edison famously said, "I have not failed. I have just found 1,000 ways that won't work." In our own journey, we have a pivot multiple times, learning from missteps to refine our solutions. No innovation is the results of one mind alone. True breakthroughs happen when diverse perspectives come together. We discovered that by fostering cross-disciplinary teams, we could lead to innovation. Capacity building is a very critical to ensure successful implementation of innovation. McKinsey & Company reports that governments with dedicated innovation teams are better equipped to tackle challenges like climate change and health care reform. Here in Egypt, we have established hundreds of departments for IT and artificial intelligence. Also, the government has a very important institution called ITI, Information Technology Institute, and this is institute explore the potentials and the people who have smart minds and technological minds that to build their capacity. They should not be the graduates of the IT departments only, but they get people from the whole country that they have the eagerness to learn more about the IT and innovation. Resistance to change is one of the biggest barriers to innovation. We have to confess. People-centric innovation is key. Many organizations fall into the trap of innovating for the sake of innovation. However, real values come from solving real problems. Political will is another essential factor. Political will means support not only financially through allocate enough fund, but also through the whole ecosystem of change, such as establishing academic departments or even agencies to encourage the transformation. Another issue I would like to highlight is sustainability. Innovation does not stop once a new solution is introduced. The true challenge lies in sustainability. How do we ensure that what we create today continues to provide value in the future? Building a culture of continuous learning and creative problem solving must evolve into a learning environment. Innovation to be sustainable, it must be designed with scalability, integrating sustainability and social responsibility. Today, innovation is not just about profitability. It must also about ethics and responsibility. We live in a world where artificial intelligence and digital transformation are shaping our lives. To sustain innovation, we must continuously leverage emerging technologies. Sustainable innovation can unlock growth, efficiency, and long-term success. As we look to the future, one thing is certain: the pace of change will only accelerate. Innovation is not a destination, it's a journey. Again, innovation is not a destination. It's not a cause in itself. It's not an end in itself. It's a journey that demands courage, creativity, and collaboration to achieve a better life for all. Let me remind myself and remind you too. The future does not belong to those who wait for a change. It belongs to those who drive it. And Africa has what it takes to drive the change. Thank you so much.
Thank you so much, His Excellency Professor Saleh, for that very precise presentation in the professor sort of style of delivery. We appreciate that presentation. At the formulation of this webinar, we looked at three aspects, which was the impetus for change, the barriers for innovations, and the sustainability, which Professor Saleh has ably been able to point out in his presentation, noting the impetus for change being a citizen-centric or people-centric approach so as to ensure that innovations actually serve the citizens that are going to be provided with such solutions. I think he has also mentioned some of the barriers that come into play in terms of enabling environments for innovations, as well as social responsibility and ethics, which should be put into consideration when developing innovations. And in terms of sustainability, I think Professor also ably indicated the importance of collaboration and inclusivity, that governments cannot operate in silos, that they must include the private sector, which is largely leading the innovation space in terms of technology, as well as academia to guide sort of research in innovations, and of course other stakeholders who are included in this whole ecosystem of innovation. So I thank you so much for really summarizing the essence of this webinar today and putting innovation in focus with that keynote address. So thank you so much again, Professor Saleh. We appreciate you for sharing the innovations that have also been done with Egypt. I'm sure we will all look at this Kermit chatbot. I think I will just start maybe with a question, is it available to all or just limited to Egypt? But you can answer that maybe later. But it's a very interesting innovation to note that it's able to sort of give feedback on the civil service law in Egypt. I think that's a very cutting edge sort of innovation. So thank you again for sharing that. Distinguished guest, allow me to move on to the next presentation. The next presentation will be a report analysis and a discussion from the 2024 Innovative Management Award Program. The Innovative Management Award Program in 2024 was hosted by the Republic of Uganda in Kampala, Uganda last year, where we saw most of our Innovative Management Awards presenters today winning awards. So for our presentation today, we shall focus on the jury. The AAPAM jury is the one that adjudicates the awards that we receive. They are instrumental in terms of going through the innovations that we receive as an organization and drafting the best innovations so that they can be able to receive the award at the ceremony. So we had earlier from Professor John Mary Kauzia, who is the chairperson of the jury. And now it is my pleasure to introduce Mr. Samuel Macharia, who is the secretary of the jury, to give the report and discuss the analysis so that we can all learn from what has been able to be shared with the jury. So without much further ado, Mr. Macharia, you have the floor. Thank you.
Thank you very much, Julie. Can I be heard?
Yes, we can hear you, sir.
Thank you. At least this time I'm heard. So all protocol observed. Ladies and gentlemen, I want to quickly share my screen so that you can see our report. This is a snapshot of the report. It's a summarized one. And I want to just quickly highlight a few things. And of course, this was the 15th Innovative Management Award. And this took place during the 43rd AAPAM Roundtable Conference in Kampala, Uganda, as has already been said. And of course, the Innovation Management Award recognizes public sector innovations across Africa and other regions, aiming to encourage effective governance and management solutions that improve public service delivery. And this year's theme was Agile and Resilient Public Administration for Sustainable Development in Africa. And just before I give the context of IMA, I like what UN Secretary General Antonio Guterres once said, and I quote, "But we need to pioneer new approaches, work differently, take risks and innovate. This means training in new skills and building the capacities of the public sector." And listening, for example, to that Kangata Care presentation done by Edward from Murang'a County, you'll agree with me that these are people who are pioneering new approaches and trying to work differently. And of course, taking risks and then innovating. And I'm glad to say that when we listen to many such of them, when we are doing the evaluation, all the way from Egypt to South Africa, from Somalia to the very western side, we in Africa, we are happy to see that innovation is taking place in the public sector. The context of IMA is that, of course, this was launched in 2005 by AAPAM. It aims to recognize innovations in public administration and management within the African public sector. And the award supports the African Union Agenda 2063 and the United Nations 2030 Agenda for Sustainable Development, promoting public service reforms and innovation that lead to improved service delivery. Indeed, some of the main lenses, again, which we use to look at these innovations or those submissions, Agenda 2063 and also the UN 2030 Agenda for Sustainable Development. Of course, we have a jury, and like we mentioned, we have our chair, who is Professor John Mary Kayuzia, Professor Extraordinaire, University of Stellenbosch, South Africa. And of course, for many years, he worked for the United Nations Department of Economic and Social Affairs. And even the UN level, that is where the innovation in public sector is domiciled, and therefore is a man who has a lot of experience and know-how. We also have Dr. Hanan Resk, who is vice chairperson from Egypt, Dr. Teferi Haile Michael from Ethiopia, Amidou Adamu from Benin, and Amidou is very useful, especially because of any submission that may come from French-speaking countries. And of course, number two, Dr. Hanan. She guides us a lot, especially when you have got some coming from the Arabic area in Africa. Number five, you have Lydia Sabohedi, South Africa, Colin Makasi, Rwanda, and myself as a secretary coming from Kenya. We have an innovation that we use to guide us. We look at innovation, whether the entry was genuinely innovative, introducing new methods, ideas, or technologies that were not previously implemented in Africa. And of course, even if you look at what was presented first, I'm glad it has been done. You'll see that there are a lot of other counties and countries coming to see what Murang'a is doing, because they see that it is genuinely innovative. And we are glad to say that even the other finalists, they did a commendable job. Relevance, of course, very, very important, whether that there's alignment of that innovation with the core function of the organization. Significance, for us, is very, very important because we want to see whether there are actual benefits to the people who are targeted by that innovation. Sustainability, yes, we don't want to see something that is there today and it is not there tomorrow. So when we hear, for example, in that presentation, that they have anchored it in policy, it means that somebody cannot just come and wish it away unless they change the law. And of course, I think that is very, very critical. So we look at sustainability and we also look at replication, because I think, and Prof has said it very well, Professor Dr. Saleh Al-Sheikh, how we need to replicate, of course, that once we see an institution doing very well, others should be ready to replicate what has been done by those other countries. So that we don't reinvent the wheel. Last year, 2024, we got 69 submissions, which came from 18 countries with a mix of English and Arabic language entries. There was no submission from Francophone Africa region this time, and this was a concern. But you also had some non-African countries like China, Pakistan, and Jordan submitting their entries. In summary, Zambia had the highest submissions at 13, followed by Mauritius at 12. And Mauritius has always been a key player. And actually, even if you visit most of their websites in different departments, you can actually see that Mauritius has taken innovation very, very seriously. Kenya too had 12 submissions, Uganda 9, Tanzania 4, Namibia had 4. And other countries included Algeria, DRC, Egypt, Ghana, Malawi, Nigeria, Somalia, South Africa, and South Sudan. Zambia, I've already mentioned about it. And of course, what we did is, first of all, that is the jury now. We did an initial screening from the 69 submissions, and we had a short list of 16 top innovations, which were further assessed through online interviews that were held between October 7 to 12. And this now allowed the jury to gain deeper insights into the projects and their impact. A few years ago, of course, submissions would be made to AAPAM, and of course the jury would have a list of maybe the top 6, and those were they are the ones who go during the finals when we have the roundtable conference. But this time, I think in the last 2 years, we have tried to give these submissions that we see are good some more time. We ask them questions. They can go and still refine, because we give them that opportunity just before they come to the final presentation. And we have seen that a lot of them, even the way perhaps they had done earlier in October, by the time they are coming to the roundtable conference, most of them will have brought in information that perhaps they didn't have before. I can assure you that what Edward has presented was not what he presented in October 7. We had to get more information wherever we found there are gaps, but after that we were able to come up with all the information required. And also for Mauritius, their chatbot, Tanzania, even Zambia, Egypt, and so on. So these were the finalists, the 5. And of course, we also came up with a special category. And Uganda Electronic Investors Protection Portal was given that, and of course they also did very well. So the final evaluations were done in Kampala, Uganda, in November 25, and these are this is the outcome. The gold award was given to Kangata Care, Universal Health Coverage, Kenya, the one that I just presented. The silver award went to National Health Insurance Management Authority, NIMA, from Zambia, which was a very, very good presentation as well. Bronze award went to Maya, Mauritius government chatbot. And of course, remember how it was presented so well. And this is something that is also doing a lot of work and enhancing service delivery in Mauritius. First runners-up, we gave a glass trophy, Digital is on Life in Egypt. Second runners-up, a glass trophy as well. Tanzania, transforming procurement in Tanzania, e-procurement system. And of course, the special category award went to Uganda Electronic Investors Protection Portal. And then we have a few recommendations, as we always do. One of them is increased submissions. Of course, we noted that the increase from 57 to 69, but we believe there is room for improvement, and would encourage more African countries, especially from Francophone and Lusophone, for Portuguese-speaking nations, to respond and set submissions, because we do interact with people from those countries in the public service, and you can assure you that there is also a lot of innovation that is going on in those places, and we need also to have them join this platform and share. Outreach to non-Anglophone countries, of course, and we have talked to Secretary General to see whether he can visit those organizations and see how they can be brought on board. And of course, we need more guidelines for international missions. It was for Africa, but we are seeing other countries are getting interested: China, Jordan, and Pakistan. And I think we are working on a framework on how these ones can be looked at alongside what is happening in the African continent. The guidelines, I think we still see, we keep seeing like those 69. You might see like almost 20 of them, which would have gone to be better as conference papers, and we are going to insist that the Secretariat provides more and more guidance and reminds them, so that papers are submitted to where they're supposed to be, and you get innovations also coming to IMA. Impact assessment, we still feel that AAPAM should conduct an impact assessment. We, on the past IMA winners, to determine how their innovations have influenced public service delivery across Africa. For example, 20 years down the line now, we want to see those winners of those few years ago, 10, 15 years ago, where are they at? And in fact, I believe that even in such a webinar, we could bring past winners. Let's hear from them. Let's hear whether there are other countries that are replicating what was an award-winning innovation. And of course, that would be very, very good feedback. Innovation database, I think that is something that we should consider, so that we document and share innovative practice across the continent. If you listen to what Edward has just presented from Murang'a, you can rest assured that if this is shared across the board, there are a lot of people who are struggling in many African countries. Health is such an issue. It would already be good if there's a universal database and people can even go to the internet or where else we can get that database, and then see things that are done, contact those who are driving that innovation, and see then what perhaps needs to be done. So in conclusion, we only say that it was very successful because we had more submissions and stronger innovation than in previous years. And we continue to praise the efforts of the AAPAM Secretariat and the organizations involved. But we still say, however, there is still a need for greater participation, particularly from non-English speaking countries, and a more structured submission process to prevent the inclusion of an unfinished and sometimes what we consider irrelevant projects. And the jury's recommendations aim to ensure that future editions of the IMA continue to recognize impactful and sustainable public sector innovation. So that is the end of the brief report. The report is normally a little bit maybe broader than that and longer, but because it's meant for consumption of AAPAM, I just had to do a summary for the purpose of this presentation. But once again, we want to thank the members of the jury. We also want to thank Secretariat so much, and of course, the champions who are driving innovation in this continent. Thank you very much.
Thank you so much, Mr. Macharia, for that presentation, and just looking at the overall state of the continent based on the 2024 submissions. I think from your presentations, we were able to see that the Innovative Management Award jury is made up of a competent, passionate, and representative jury, which caters for most of the languages spoken on the continent, including Arabic, French, English. We are empowering the Secretary General to support us with the Swahili language. And then, of course, we are now calling upon the Portuguese-speaking countries to also submit their innovations for evaluations and sharing. I think you have also made clear the criteria for selection that the jury looks for. And I hope this has also illuminated on how people can be able to submit their innovations to AAPAM. So thank you for that. And then you've also mentioned quite importantly that we have seen a notable increase in terms of submission of innovations, and this is a positive trajectory for the continent. We have seen not only an increase in the quantity, but also in the quality of the submissions that have been made. We're seeing a lot of submissions being, of course, enabled through technology, but also some that are not necessarily enabled by technology, but are still very good innovations, and we applaud the continent for those many submissions that we have received. Indeed, it's important to do impact assessment and ensure sustainability of the programs, as we have noted from all the speakers who have spoken previously. They have mentioned that there is definitely a plan to ensure sustainability of the programs. And I think we are, even now as we're doing this capacity building program, it is a way of ensuring that these programs can be replicated and they can also be sustainable throughout the entire continent. So thank you again for that. I think what has struck my mind is the lifeline of an innovation. Can we say that an innovation that was developed 10 years ago is still an innovation, or has it gone through the process of the life cycle of an innovation? Meaning, has it been replicated in other countries? Has it been mainstreamed? Does it still constitute of an innovation, or do we now escalate it to become a best practice? So that is something that perhaps we can discuss, whether 10 years ago it's still an innovation or has been mainstreamed to become a best practice. But all in all, thank you so much. Again, we had reconstituted this session, but now we will be moving to the rest of the program. But thank you so much, speakers, for sharing your insights on the session. Again, I invite my colleague Clifford to take us through the IMA presentations. Kindly note that you all have about 10 minutes to share your presentation so that we can proceed with the Q&A session. Thank you so much.
Thank you so much, Julie, and the presenters that we have heard from. Allow me, without any further ado, to invite our next presenter. Our presenter is Colonel Edith Nakalema. She's going to take us through Uganda Electronic Investors Protection Portal. And allow me just to briefly read a brief bio of Colonel Edith Nakalema Sizwa. Colonel Nakalema is the head of Uganda State House Investors Protection Unit. She starts with safeguarding investors' interest. She previously led the State House Anti-Corruption Unit and served as a personal assistant President Yoweri, His Excellency President Yoweri Museveni of Uganda. With a background in security strategy, she's a graduate of the UK Defence Academy and the National Defence College of Uganda. She has played a key role in government, financial management, and anti-corruption efforts. Her work has earned global recognition with engagements at the UN, White House, and Buckingham Palace. She has also authored an anti-corruption report. I take this opportunity to welcome Colonel Edith to take us through this session. Kindly, we have around 10 minutes so that we do not eat into so much time. Thank you. Welcome.
Thank you very much, distinguished listeners and maybe viewers. It is a pleasure for me to once again appear at this very esteemed AAPAM audience. The distinguished Secretary General, Professor Scott, the chairman of the jury, Professor Johnny Mary Kauzia, and the secretary of the jury, all of you distinguished participants of this great webinar. I want to appreciate His Excellency Professor Sari for ably describing to us the importance and the maybe definition of the disruptive innovation. And so while I had earlier put in my
Hello, Madam Edith. I think she's having a challenge. Hello, Madam. As we sort out the problem, you'll just allow us now to go to the next presenter, kindly, so that we do not waste so much time as we sort out Colonel Edith's presentation. Yes, please.
Her Excellency, come back. She's come back.
Okay, thank you. Welcome back, Colonel Edith. Sorry about that.
I don't know what. So now you can't tell where to start from because I've been talking all along. Anyway. Nice. So
we lost you when you were thanking the minister.
How am I to be embarrassed? Can you hear me?
Yes, we can. Kindly go ahead. Thank you very much. Hello. Hello, Madam Colonel Edith. Can you hear us?
I think I would advise you exit and then rejoin so that the audio can synchronize to the Zoom platform. So I think you're facing a challenge with the audio.
Yes, as we do that. Hello, Madam Colonel Edith.
Yes. Can
Can
you
you
see
hear
my
us?
presentation? Yes, I can hear you.
We can hear you now.
Do you see my presentation?
We will,
No.
we will share. No, we are not able to see the presentation.
So can I share it from my end?
I think Colonel Edith is experiencing some challenges. Distinguished participants, you'll just kindly allow me to invite the next presenter as we sort out her presentation, so that she will come immediately after the next presenter. You'll allow me to invite Mr. Gopalen Pavade, the lead program manager from Central Information Bureau in Mauritius. Allow me to kindly read through a brief bio of our presenter who is going to take us through the Mauritius government chat box. Mr. Gopalen Pavade is a lead program manager. He's a lead program manager at Mauritius Central Information Bureau with over 30 years of expertise in ICT and public sector digital transformation. He spearheaded major innovations, including the Mauritius National Identity Card, Mobile ID, and the Advanced Passenger Information System. His background in banking has enabled him to implement high-impact projects in governance and technology. A recipient of the Star Achiever Award from GECCI, he holds a BTech Honors in Computer Science, an MBA, and a postgraduate. Kindly mute your microphones, please. He holds a BTech Honors in Computer Science, an MBA, and a postgraduate diploma from Dublin City University. His leadership in digital transformation is shaping the future of public service. Most welcome, sir. Thank you.
Thank you for this introduction, Clifford. Thank you to the team. I will try to share my presentation to you and on the government of Mauritius chatbot. Can you see the presentation, Clifford?
Yes, we can see it. Thank you.
Yes. In fact, when we thought of the government chatbot, we thought of a system whereby queries and transactions from the public could be handled by not a public officer, but by a friendly chatbot, by an AI. At that time, we were in 2021. We were in the period of COVID, and we designed this chatbot with that purpose in mind. We should be able to transact and relieve our public officers of some of the hassle we are having, especially because we have few staff in all government office. We implemented the chatbot with the help of many stakeholders, and today, therefore, I'm going to present to you quickly the whole governance of this chatbot, what are we doing with the chatbot, and also a clear roadmap on what we want to do for the future of this chatbot. And during that presentation, I'm going to share with you also some of the challenges we face in implementing this chatbot project. Basically, one of the most difficult challenge of a government project is that governance. We need to have this governance. It's like a steering wheel. You can see that. We have to set up this steering committee. And this steering committee was under the Ministry of Technology, where I am. And then we had subcommittees meeting regularly every 2 weeks or every week to monitor the implementation. Then it's the work of many stakeholders. All these kind of project involves a number of stakeholders. We see we have the telecom operators, we have the chatbot supplier, we have also the chatbot is interfacing with many systems, the suppliers of these systems as well, and the government office. Here you will see that we have one of the major component of the project is about communicating with the public officers, informing them, doing the change management. One of my colleagues here is at the citizen support portal explaining the chatbot and the benefits of the chatbot and getting data from the public officers. That element was so important, and we work with what is called the citizen support unit of the Prime Minister's office. We have a small video of the chatbot.
Hi, I am Maya, your government bot. How can I help you?
Like you saw in the video, Maya is operational since 2023. And with time, what happened is that we also implemented the humanoid, where the humanoid, in fact, is only a channel through Maya. Therefore, whenever we talk with the humanoid answers the queries and data from the data that we have fed through Maya. Therefore, that interface is very popular. In fact, when we bring Maya to some event, the humanoid to some event, people crowd around the humanoid and ask questions. And this is something very beautiful, because then people realize the importance of AI, how AI can really help the citizen. Before Maya, let us see what happened before Maya. Before Maya, when people want to interact with the government, they had to go to the website of the ministries, or they have to walk to the offices. And then many often you will see the website are not personalized, with lack of engagement. And then whenever we call the officers in our public office, we see that they are overloaded, and we have to wait sometimes 2 or 3 minutes, or even sometimes several minutes before we get an issue resolved. The navigation is difficult. And then also one of the difficulty we are having is that we don't have staff to manage the help desk and so on. We have a problem of language barrier. Some people, they don't know how to call and get the information from the website. They wanted to have something easier to use. That's why Maya came in. Maya, the solution is we have more personalization. Whatever question we ask, at the back, Maya gets data from the different government system and provide that information. And how many questions we ask, Maya will never be unhappy, will answer in a helpful manner, what we call is the helpful intent. Maya is always friendly. The navigation through the website is not required, because we just go to the chatbot and then ask the questions. It's like on your WhatsApp, you ask a question and then you get the answer. Now, the beauty of Maya is that we have integrated not only the text chat, but we also have the voice capability. Both Maya can talk to us and we can talk to Maya. the information is accurate because it is powered from the government systems. And the language we are supporting is English, French, and Mauritian Creole. We had some issues with Mauritian Creole later, and we had to remove it, but we will tell you more a bit later. Now, basically the technology that we are using for Maya. Previously, when we started in 2021, 2022, there was a lot of questions that had to be fed to the bot, what we call the FAQ, the question and answer, the different variances and different responses. And then Maya was just going to the data using the dialogue management and answering that based on the confidence. But now, what is happening? I think one of the questions was about earlier, you mentioned about the lifeline and of the innovation and so on. In fact, Maya relies on the latest AI technology, machine learning technology. Now, there's no need to feed any data to Maya. We just give a URL to Maya, and the Maya will at the back scrape the website or the document and then produce the data. The training is much easier now. We don't have to feed loads of data. We just one or two website, URL, and the documents. We are doing that for all the websites on which Maya is now. Now, second challenge we have also with Maya was that whenever we were talking with Maya in 2022-23, we were realizing that Maya was sometimes giving some incorrect responses and couldn't understand our intention. In fact, Maya now is very, very intelligent. In fact, Maya understands the context better. How? Because we interface with GPT. Therefore, the GPT LLM came in and we quickly integrated with that LLM so that we could understand the intent of all the questions of the citizen. Similarly, in terms of the context, Maya understands the context of the conversation. For example, if I ask him, who is the Prime Minister? And then later ask Maya, where does he live? Maya will know that he refers to the Prime Minister. The language generation also is important because Maya answers in a beautiful language. There's no need to provide multiple responses. Therefore, Maya sometimes is so, the language is so natural that people believe that Maya is a human being seated at the back. The knowledge base, sometimes whenever we have the data of the government, we also have some questions. For example, some people will still ask us, what are the beautiful beaches of Mauritius? How do you cook a dal puri or whatever? Therefore, Maya will use the GPT database to answer these questions as well. Therefore, Maya is basically like now limitless. But we move from conversational quickly to transactional. Why? Because we realize that Maya is not just a conversational chatbot. It can do more than that. For example, I talk to Maya or I text with Maya. I can ask Maya to download my birth certificate. I can download my civil status document, but I can also book an appointment. Whether I'm going to the passport office or the civil status office, I just ask Maya to book an appointment for me, and Maya will do that. We'll see that later. And then Maya also, there are so many complaints we receive from the citizens. Sometimes when they are not happy, the citizen, they will go to the radio and vent their frustration there. Now what is happening, we can create a ticket automatically. Citizen just talk to Maya and Maya creates the ticket for them. And then they can talk to Maya, get the status of their ticket, where they are. The beauty of Maya is that we need to identify people, and Maya does that beautifully. Why? Because we have MoPass, which is a digital ID. It's a digital ID for the citizen of Mauritius. And now when we interact with Maya, once I authenticate with Maya, with MoPass through Maya, I can avail of the services. Therefore, that authentication is what makes Maya so powerful. Once I'm authenticated, I can do so many services. And we are working with other services, you see, like the renewal of passport and so on, through the transactional services of Maya. Just to give you an example, Maya, on the left, you see, I'm talking to Maya. I want to download my birth certificate. In fact, I prepared that for the AAPAM award when I was presenting. I want to download my birth certificate, and Maya will ask me to log in. I log in and authenticate through the MoPass, through the Maya interface. Then I will type in my OTP and I get my birth certificate. You see, the birth certificate is on the right now. This birth certificate is digitally signed as well. Therefore, Maya interfaces beautifully with our government system that we have. And this certificate, you see, is digitally signed, and I get it at the comfort of my home. I talk to Maya, I get my birth certificate. Another scenario is here where we are showing the transactional power of Maya is, for example, I want to book an appointment. This is a real thing I did. I wanted to book an appointment for the passport and immigration. Maya will ask me to select the office and select what is the service I want, renewal or new, whatever, the date, and then will print a ticket for me. You see, this ticket is available and I get it not only on Maya, but also I get it on my email and on my Mo Rendezvous application, mobile app. Therefore, Maya interfaces with these transactional services so that makes life easy for the citizen. In fact, citizens, they like that kind of interaction. They don't want to navigate website or send long email. They want the services to be online and in easy manner. This allows them to interact smoothly with the chatbot. Now, one of the things that we realize also is that beside going to the transaction, we want to have engagement of the citizen. In some of our transactions, we want to know what the citizen think. For example, right now, the government, since the beginning of this year, the new government came in. The new government wants to implement what is called a blueprint, a strategy paper. Then they wanted to collect input from citizens, and quickly we developed that small interface on Maya. You see, when I interact with Maya on the left, Maya is telling me to give my feedback. And this engagement, citizen participation, is getting a lot of input from the citizen. Citizen now submit their input, and at the end of the day, what happened is that there's an agent AI, Maya, at the back that summarizes that data and send it to us. Therefore, we don't have, in fact, we are here at the end of the day just collecting summarized data from Maya about the blueprint, and these are being used. Another thing we implemented, the new management wanted to fully leverage on the humanoid on the 7th floor where we are working, where the minister is. Whenever a visitor comes in, Maya will greet the visitor. If the visitor is a known visitor, the visitor will say, "Hi, Mr. Pavadi, hi, Ansumati," like that, and then we'll greet the citizen, and the citizen can be channeled to the reception desk. Let us see what is happening at the back in terms of architecture, so that we can replicate it if we want in other countries as well. What happened? The whole Maya can be seated on the cloud environment. In fact, Maya is seated on the Amazon cloud infrastructure, except for some of the government services backend, like we were saying about MOPAS. All these are in our government cloud in Mauritius. Otherwise, all the public information are on Amazon. In terms of channel, you can access Maya right now on 8 ministries' website. You can also access it on a central mobile app. And then, so that people can interact toll-free with Maya, they can also send an SMS to Maya, and Maya will respond back. There's no need to pay. Maya, I told you, is also on a humanoid as a channel. And then this, in 2024, we implemented Maya on a WhatsApp number. Therefore, people use their WhatsApp account and talk to Maya and get their response. At the back, there's all that technology behind, whereby Maya pulls data from its knowledge base, but then also interfaces with GPT whenever required. And then on the right, you will see all our government system that we have, our ID will pass, so that I can authenticate with Maya, our rendezvous system, it's a booking system, our citizen support system, and our document repository system. This document repository system interfaces smoothly with our data sharing platform, so that I can get data from the civil status. All this is happening at the back, so that you have a very nice interface for the citizen in front. We also have a MoSign certificate authority, where we sign all digital documents that are sent to the citizen. Because when we go online, we need to have that form of security. We need to build that trust, and this trust is provided by our digital certificate authority, MoSign, which we built during that COVID period as well. And then a very good central population database where the data of the citizen is there. This one was cleaned way back. Therefore, Maya interface, the difficulty, one of the difficulties for this kind of system to interface with government system. Let us move on to where we are with Maya. In fact, we started with 3 bots, 3 independent bots, one in the civil status, one in the CSU, one in the government land center, but then finally we had to realize that we wanted also the voice. This was the phase 2, voice transaction. We can talk, we can transact as well. And then the technology was now mature enough. People were talking about the technology, but if we don't have the technology mature enough, we cannot use it. If you see the Gartner life cycle also, we need to have technology where we have the impact. If now Maya has that capacity to scrape, we leverage on that scraping as well. And then we implemented what we call a master bot. Instead of having 3 bots, we merge all these together. It's like one master bot with all the knowledge of the government, and we can talk to the bot. Then we have all these channels with WhatsApp interface. Now what are we doing now? Currently, if you see the yellow or what we are doing now, we are working on the motion Creole. When we interface with GPT or we interface with Gemini, the difficulty that we didn't have prior to 2024 motion Creole. We had iChain Creole. This is a difficulty. Therefore, when people were talking motion Creole, Maya was confused with that, was replying in iChain Creole. Therefore, that had to be stopped. Since February 2024, so we have now on Google and on GPT motion Creole. Therefore, this is the work that is ongoing. Then also the interfaces with other models. Sometimes you see with these AI models and so on, we have the difficulty that we don't get that level of accuracy that we want. It will try, it's a generative AI. We will try to formulate the answer in a manner which may not be exactly as we want it, especially for legal documents and so on. That's why we are trying to see how we can interface with other AI models, including the RAG, which we call the retrieval augmented, so that we have a more accuracy. Then we are talking of more transactional services. Like you see on the right, some of the challenges is the testing of the bot. We didn't want to release a bot where there will be inaccuracies or hallucination and so on. Therefore, we had to test. The testing takes a lot of time, especially because of these new technologies and so on. The interfacing, if you have government system, you need to interface with them. You have to provide for these kind of interfaces and testing these interfaces. The challenge of accuracy we mentioned, and the hallucination. Basically, the hallucination is that, let us say you ask the chatbot who is the prime minister. Instead of giving the current prime minister, he's convinced that the previous prime minister who is still here. Therefore, this is a major issue. We have to address these issues as well. Therefore, the testing is important, and the fact that we cannot 100% sometimes rely on the AI was a challenge, and we had to work around to find workaround and test and remedy these as well. Now we are using Maya, therefore, beautifully, and every day basically we are getting like more than 100 of these transaction. People are calling, even the diaspora are talking to us. They want to see the procedures for doing such and such transaction in Mauritius, the business community and so on. Therefore, we are fully using Maya now. This is a bit about the presentation I wanted to share with you, and definitely working with that AI, where AI replaces the public officers, like it's like a digital employee. It marks the dawn of something new for us, for the world. Therefore, we have to work with the AI. We have, as a human, to work with this AI technology, and then we can use it so that our public officers can do more productive work and new work that are very valuable. Thank you everyone.
Thank you so much for that elaborate presentation, Mr. Abadei, and we sincerely appreciate. Allow me just to briefly give a summary of your presentation on the Mauritius government chat box. And you have noted that it's an AI-powered chat box that has enhanced accessibility and effectiveness of government services. That's improving service delivery in Mauritius. And you have noted that the chat box is designed to help citizens navigate various government services more easily. And it has provided information on various public service, explaining administrative procedures and even guiding users on how to complete tasks online, which now that's the aspect of human interaction. So this is more effective in that someone can easily access services online. And I think one of the benefits that I've noted is this service is 24/7. It's available 24/7 and anyone can access it anytime. That's making it easily available to any citizen, and they can receive assistance at any given time. That's reducing the need of physical visits or long waiting time that are always characteristics of most government offices. You go to a government office, you get queues, you have to wait. Now it has cut all that, and you're able to get service instantly. And I think you've noted that challenges are inevitable, and the government of Mauritius have noted the various challenges that it has encountered, and they are in continuous improving these areas that need improvement in order to overcome these challenges and make sure that it is more, it gives services as expected, 100%. And we want to thank you for that. And the chat box represent, just to summarize, the chat box represent an important step in technology, in leveraging technology to enhance public service delivery. And we hope that other African countries will replicate this aspect to ensure that service delivery has been enhanced 100%. And I think that one thing that you noted is this, it was put in place during COVID. And you remember during COVID, most countries were caught off guard. Those ones which were not, countries that were not able to implicate, to rather have digital transformation or such kind of services, were not able to give services to people. And I think this is a good step that other countries can replicate. So we thank you very much for that presentation. And just stick around. I know we'll be having questions at the end of this session, which we'll respond to. And I'll now take this opportunity to welcome back our previous presenter, Colonel Edith. I think I've gotten a message that the issue has been sorted out. So I take this opportunity to.
Again, he's pausing.
Please.
My
Hello.
very sincere apologies. Hello.
Yes, I can hear you. Yes.
Okay, very
Yes.
sincere
Can you go ahead?
apologies for what has happened, and I would like to proceed with our presentation. Please, the first slide. So, yes, at the State House Investors Protection Unit and distinguished guests, distinguished panelists of the very esteemed AAPAM, it is once again our humbling pleasure to take part or to participate in this AAPAM webinar to present on the disruptive innovation for people-centric services. Next slide. I will not disturb all of us by defining innovation, because His Excellency Professor Sari has described disruptive innovation very well. But just going through the definition given to us by Professor Clayton at the Business School of Harvard, disruptive innovation is a process where a smaller company or companies, often with fewer resources, challenges established businesses by entering at the bottom of the market and moving up, eventually displacing them. So we believe in transformative innovations, and we thank AAPAM and the leadership of AAPAM for giving us an opportunity to present on the innovations that we have in Uganda, especially the Electronic Investors Protection Portal. Next slide. So the need for disruptive innovation in service delivery to us at the State House Investors Protection Unit in Uganda, we looked at it to address 3 critical challenges or issues, including fraud and corruption, human interaction risks, and lack of collaboration and coordination among ministries, departments, and agencies in the government and the private sector. So having interacted with a number of investors, both local and foreign, we realized that there is need for using automated services or applying innovation services to limit human interaction, to increase transparency and accountability online. And so we worked together with the government system here in Uganda called the National Technology Information Authority, NITA Uganda, and the technical people in the IT sector, the private people. And we came up with Uganda's Electronic Investors Protection Portal to increase service delivery using innovation. Next slide. Well, who we are, I don't think we need to explain who we are again. The State House Investors Protection Unit, of course, operates under the delegated powers of His Excellency, the President of the Republic of Uganda, in the powers vested to him by the Constitution of the Republic of Uganda, Article 99(4) or subsection 4. Our vision at the State House Investors Protection Unit, or SHIPU briefly, is to have a thriving investment climate in Uganda and Africa as a whole. Our mission is to coordinate with all stakeholders for a secure investment landscape. And our tagline that has really been embraced by very many people, not only in Uganda, but across nations, is empowering investors. Next slide. How we apply disruptive innovation and people-centric services. I want at this stage, because of time, I am sure people have all been listening in the good presentations, and we have learned a lot on how innovations are improving Africa's service delivery, and we are joining the global market. So allow me present on how Uganda's Electronic Investors Protection Portal works to address the challenge of delays in investment and how it is helping us to have investors flow increase in nations. So the Uganda's Electronic Investors Protection Portal is accessible online through all search engines, including Google. When you enter Google, you can only click in and type the word protection.statehousinvest.go.ug, and bringing together all services. You just go straight on the word services, and you'll find all the departments, all the agencies that support investments in Uganda. The process of investing in Uganda, you find all agencies together at the word services. When you click down, you'll see investing in Uganda. You click at investing in Uganda, you'll immediately access Uganda Investment Authority. So we have merged all agencies that support, that protect, and promote investments in Uganda. And with that, they also access, those agencies access our Electronic Investors Protection Portal as a country. And so we have seen an increase in FDIs, the foreign direct investments, but also the local investors are being helped without having to travel or spend on paperwork, but also to be diverted by wrong elements or unscrupulous intermediaries. So we have all agencies. When you talk of registering a business in Uganda, just click on the word registering a business. It will quickly, you'll quickly access Uganda Registration Services Bureau through this portal. And when you want to go back, because we are just showing for a matter of, because of time, we don't want to. So when you want to launch any we also have Explore Uganda. It will take you to Uganda Tourism Board. Working in Uganda, it will take you to immigration, the Directorate of Immigration, where you access visas, work permits, and all that is needed to register a business or for any visitor to access the country online. And Uganda Revenue Authority will be accessed through the word incentives and tax education. So we have brought together all the agencies that support, that promote, and guide investors on this Uganda's Electronic Investors Protection Portal. In that, we are addressing the challenge of unnecessary delays in movement from office to another. So we have seen investors appreciate from all over that Uganda Electronic Investors Protection Portal has brought together services by addressing the challenge of working in silos. Governments working in silos or countries working in silos, because we intend to connect to other countries depending on how they would appreciate this portal. We have had a number of investors from Middle East, from China. This portal also have a language translation provision or system operating. When you want to know how our country, the operational framework of Uganda is also accessed, all the documents, all the necessary information about who we run or how the country is run. I shouldn't put myself among those that are running the country, but Uganda's National Development Plan 4 and Plan 3 and 4 are loaded. You find them on this Uganda's Electronic Investors Protection Portal. You find our Uganda's Vision 2040. You find a resource center also. So to inquire for any investor or anyone interested to know more about Uganda, including tourists, you can just click on the word inquiry and you register whatever you want, or you ask for anything you want to know about touring Uganda, investing in Uganda, or how the country looks like. Again, that would be tourism still. So this is a very short form. We just put your name, ask us a question, and you will be answered instantly. We also have a live chat where you can ask and online, and you will have a direct interaction with our officers in our information center. We also have the electronic portal also has a provision of a whistleblowing anonymous reporting. So you may not want to be known, and so we still can get your views, or we can be informed of what is not going right in the area of investing in Uganda or touring the country, and we shall definitely reply online. Frequently asked questions are many, and if FAQs, we also access what is asked and will give answers. Next is compiling a comprehensive complaint. Just click on report. There you can even attach a video, you can attach a document of whatever volume, up to 60 MDs. I hope I'm being heard. Hello? Do I still have the audience?
Yes, we can hear you, madam. Thank you.
Much. Next, let's see how the EIPP works. A video of how EIPP works. Fine.
How to use the EIPP. Welcome to the Electronic Investors and Protection Portal, your guide to seamless investment processes in Uganda. Step 1. Navigate the portal. Start by searching protectionstatehousinvest.go.ug. On Google, use the menu bar for various tasks. Step 2. Submitting a complaint. To lodge a complaint, click Report. Fill out the form, submit and note your reference number. Step 3. Making an inquiry. For inquiries, select Inquiry. Complete the form, submit and record your reference number. Step 4. Whistleblowing. To report anonymously, choose Whistleblow, fill the form and submit. Step 5. Accessing FAQs. Find the answers to the common questions under the FAQs link. Step 6. Seeking information. For investment cycle guidance, hover over Resources, click Resources Center and explore. Step 7. Exploring services. Hover over Services for stakeholder offerings like business registration. Step 8. Tracking progress. To track submissions, click Report, select Track Inquiry or Complaint. Enter your reference number and check your email for updates. Need more help? Call +256 326 100 630 or email info@statehouseinvest.go.ug. How to use
We were showing how the electronic investors protection portal works and how it is applied to fit in the disruptive innovation in addressing people-centric services. We now go to the impact of disruptive innovation on service delivery. Number one, we have seen enhanced investor confidence. There is increased transparency, predictability, and responsiveness which has built a lot of trust, and this has increased investment flows and growth in Uganda. The second good impact we have realized is there is improved efficiency in service delivery. There's a reduction in necessary bureaucratic delays and red tapeism because of adopting innovation or digital solutions, and it has accelerated project approvals, and we see resolutions of disputes being done online, and those we interact with face-to-face, they come appreciating the online services. And so we really, really appreciate the importance of disruptive innovation on service delivery. The other good impact we realized in the last coming to 2 years now of the electronic investors protection portal in operation, there is economic growth, job creation. And we have seen an increase in the job creation because of the many online services and merging together agencies and collaborating with the private sector online, because online services through IT innovations have really brought together many agencies and indeed given many opportunities in for jobs. So there is a smoother investment environment that has attracted more investors, has boosted economic activities, has created employment opportunities, and we see increased contribution to our GDP growth. There is improved reputation about service delivery, and so demonstrating commitment to investor protection enhances global competitiveness and attracts increased foreign direct investment, FDIs. And we see inclusive and sustainable development in our country's operations. Simplifying investment processes and protecting investors results into increased growth in multi-sectors such as agriculture, technology, manufacturing, and infrastructure, not excluding other informal services that access online services. Next slide. Yes, we wanted also to talk about the innovation development process that we went through, but given that it's written and purposes time, looking, please, can Can we go back to our slides? How we, guys. Yes. Innovation development process. We are looking at innovation cycle. I think I will leave the document because of time. Innovation cycle, we have, we did research, needs assessment. We also did design thinking and workshops. Of course, we didn't have to look for for a lot of resources to have workshops or to do benchmarking outside, but having listened to the challenges that investors were facing, both locally and those that came from other countries or DIs, we realized that there was need for us to bring on board other agencies or heads of agencies to work together and address those challenges. So we did a pilot implementation with selected investors and agencies. Then we did evaluation, refinement, and full scale by requesting His Excellency the President to commission the electronic portal when we were satisfied that it was addressing most of the challenges, if not all, having worked with all agencies that are in support, in guidance, all that are given roles to ensure that investing in Uganda is not delayed or is not negatively affected. So resource mobilization, again, we didn't have to look for lots of resources, but we used the technical support from National Information Authority, which has that mandate of hosting but first developing and hosting IT systems in the country. And then we cooperated or collaborated with private sector actors which include the Private Sector Foundation of Uganda, PSFU, Uganda Manufacturers Association, the Kampala City Traders Association, and many others, together with the technical people in the private sector. And we came up with the Electronic Investors Protection Portal, which has increased the flow of investors, and in particular FDIs, by over 80% currently. The technical approach, locally developed solutions using Ugandan software developers. We didn't, this portal was not developed by expatriates, but it was locally developed by the technical local Ugandans. And we use cloud-based architecture to have enough space for all that we need, and we don't have to buy or to look for expatriates or to have other storage systems that can be filled or that are limited by capacity. So we are sure that we can have all that we need in terms of information, in terms of we have enough storage because of the AI that is improving systems, and integration with existing government systems through APIS. The technical people have their methods of explaining that, but we are again leveraging technology to ensure that the system is not limited by storage, is not limited by access, is not limited by human interests. Implementation challenges. We admit that data standardization across agencies with different systems is still a challenge, because we can only be sure of what we are in charge of what we store and how we offer services. But other agencies, it is still, we still rely on what we can access online. And so we cannot talk about this, the data that is in other, that is stored or accessed by other agencies. But what we do is to give confidence to all investors through accessing all services in this very portal that brings together many ministries, departments, and agencies in support, in guidance, and in protection of investors. Authentication and security concerns. Again, it's about ensuring data protection by a regulated and a regulated agents of government that is mandated with ensuring that the data and information storage is safe and secure. Yes, challenge, the change management strategies. We are using innovations still to ensure that every challenge that comes up, we engage with the NITA, the Uganda Information, the National Information Authority, Uganda, to ensure that all challenges that affect online systems are addressed by that government agency. Next slide. And we're coming to the end. We are showing how the Electronic Investor Protection Portal brings together all ministries, departments, and agencies of government to improve efficiency and also to eliminate the challenge of working in silos. So we are showing how we are interlinked to all other agencies, which include UAI, which is Uganda Investment Authority, URA, Uganda Revenue Authority, URSB is Uganda Registration Services Bureau, many other ministries, including the private sector foundation of Uganda, and the academia. We have Makerere University because of research, professors and doctors of philosophy continue to guide us on how to make the investment landscape in Uganda continue improving. Next slide. As we conclude, the outcome of the Uganda's Electronic Investors Protection Portal, our comprehensive impact assessment combines quantitative metrics with qualitative feedback to provide a holistic view of the Electronic Investors Protection Portal effectiveness. What began as a solution to streamline dispute resolution has evolved into a catalyst for broader improvements in Uganda's investment ecosystem. There is increased efficiency. Over 90% of registered concerns are addressed in real time. The depth of reach. We at the State House Investors Protection Unit, through the Electronic Investors Protection Portal, EIPP, we interact with numerous businesses and investments. So far, we see, we've realized the worth of over $1 billion United States dollars. Feedback and interaction through social media and traditional media interaction, we reach up to 2 million people per month, and that's 80%. And 80% of the sentiments of these interactional engagements is always positive. We have positive feedback from the public through online comments and compliments. Okay, the future, before the future, lessons learned. Critical insights. Yes, the lessons learned. We have critical insights, which we have outlined here, and they include
We have
Under
2
critical
minutes, please.
insights. Yes, I'm concluding, sir. Early and continuous stakeholder engagement was essential for adoption. User experience is more important than technical sophistication. Starting with a minimum viable products allowed for quicker launch and iterative improvement. Multi-channel support through websites, mobile, SMS, WhatsApp, and a call center increased accessibility. A lesson learned number 2, unexpected outcomes. It became a knowledge repository of common issues and resolutions. It created healthy competition between agencies, ministries, and departments to improve response times. It also attracted interests from neighboring countries for knowledge sharing. Lesson learned number 3, adoption journey. User feedback led to simplified interface design after the first 3 months of the EIPP existence or operation. Addition of business intelligence features based on data patterns. Finally, integration with investment aftercare programs for holistic support. Conclusion. I'd like to conclude by saying that the State House Investors Protection Unit believe that protecting investors is not just about security, it's about innovation, responsiveness, and inclusion. By embracing disruptive technologies and designing a people-centric services, we are not only improving how we serve investors, but we are also accelerating Uganda's journey towards sustainable, inclusive development. I thank you.
Thank you so much, Colonel Edith, for that elaborate presentation. And I want to sincerely thank you for that presentation. Allow me to just briefly note a few areas as a form of summary about the program. You've noted that the portal is a government-backed digital platform developed by the State House Investors Protection Unit. And it was launched by His Excellency President Yoweri Museveni to enhance investors' confidence and streamline government processes in Uganda. And the portal is designed to provide both domestic and foreign investors with authentic information. And it also serves as one-stop shop for inquiries and verification and feedback for them. And one thing that has also caught my attention is that it helps with fraud prevention and transparency by offering a robust reporting mechanism. And it also helps prevent investors' fraud and corruption by allowing investors to file complaints and track the progress of their inquiries, thus giving them complete feedback as far as these aspects are concerned. And we have also noted that the system connects investors directly with relevant government agencies, such as the Uganda Investors Authority, Uganda Bureau Services, Uganda Revenue Authorities, therefore reducing bureaucracy and delays that might be affected, might always be there. And one factor or one key feature that I think stood out for me is that investors can easily make inquiries, submit complaints online, and receive timely feedback anonymously. Someone doesn't have to train who they are, but they can key in information anonymously and receive feedback. And also you can able to track and monitor submissions, given a unique reference number, allowing users to track the status of complaint or inquiry, so that you are able to know where your inquiry has reached and get instant feedback. I think also you noted that this particular portal hosts various government and critical government documents, including various manifestos of government organizations. And also the last part is that there's an online chat service that enables real-time assistance from State House unit, and there's plans to fully automate it into all-driven chat system. Allow me to end there, and I sincerely want to thank you for that presentation. I know we have a lot of questions that are awaiting. I can see our question and answer platform has got a number of questions. We'll go through them once we finalize this webinar discussion. Without any further ado, allow me to invite our next presenter, who is going to be Engineer Gaba Labib. She's going to take us through digital decent life. And allow me to now just briefly read a brief profile of Engineer Gaba Labib. Engineer Gaba Labib is Egypt's Deputy Minister for Institutional Development at the Ministry of Communication and Information Technology, with 30 years of experience in public policy and IT. She has held key government positions, including Deputy Minister of Planning for Administration Reforms and Advisor to the Prime Minister. Allow me also to mention she was our Vice President or Deputy President for the North Africa AAPAM Executive Committee. She has experience in digital transformation. She has led numerous high-impact projects and represented Egypt globally. She holds degrees in engineering, business administration, and law, and she has received over 15 awards, including recognition among Egypt's 50 most influential women. She continues to drive institution reforms and digital innovation in the public sector. I take this opportunity to welcome Engineer. Thank you. Oh, I'm being told, I'm being informed that the engineer is not there, but there's a team from the ministry who are going to represent the minister, the deputy minister. Kindly go ahead, please. Thank you.
Good afternoon.
Good afternoon to you and most welcome, Engineer Rafida. Thank you.
My name is Rufaida Mahmoud. I am working as a project manager in the Ministry of Communication and Information Technology. And my colleague, Minja Muhammad Abdurrahman, with me to present our digital decent life super app حكايتنا. Let me first say that to accelerate Africa's path towards realizing the vision of Agenda 2063 and the Global Sustainable Development Goals, we must strategically leverage digital innovation as a catalyst for inclusive growth, sustainable development, and transformation change, focusing on building a robust digital infrastructure, promoting digital literacy, and supporting innovation solutions that bridge gaps and empower communities across the continent. One of our innovation projects, which is Digital Decent Life حكايتنا super app, and I am honored to present our project. So let's start directly and take a look at MCIT efforts and حكايتنا super app. The ministry has the goals such as increasing ICT contribution to GDP, creating jobs in the digital economy, promoting digital innovation, and leading Egyptian digital transformation. Also, the Egyptian Ministry of Communication has made another significant stride in the ICT sector over the past 5 years to support digital innovation. The first thing is doubled mobile towers from 18,000 mobile tower to 37,000 tower. 5G license were granted to mobile network operators with an investment of $675 million, replacing outdated copper infrastructure with fiber optics cable throughout the Republic by 150 billion Egyptian baht. And those 3 improvements reflected on the Egyptian rank in fixed speed test, where Egypt ranks the first on the continent of Africa. The institutional development sector in MCIT working on digital capacity building, digital literacy, and digital development programs to the people of Egypt, where the numbers have reached about or around 1,273,000. The developing in the Egyptian post offices, where there are 4,527 post offices, has developed among all over the country out of 4,600 offices. Also, there is 83 new post offices has established in 2024. 130 postal outlets among the country. Also, we have the first drive-through post office in Africa and the Middle East. حكايتنا means our story in English. The idea for the super app حكايتنا was inspired from studies that measure the development impact of MCIT efforts in the village to ensure the sustainability of digital transformation projects. حكايتنا Super App is a smart and interactive digital system to achieve the digital and developmental goals through a mobile application and portal in a secure national digital environment to raise awareness, digital interaction, and promote digital participation of citizens through a secure national digital ecosystem. The Super App function as an innovative and interactive system to achieve the ministry development goals, promote digital literacy and digital awareness among citizens. The last one is promote citizen participation in the digital initiatives. حكايتنا focuses on 3 goals, which are the first one, digital sustainability, which aims to create a safe, productive, and sustainable digital society through enhanced cybersecurity, responsible technology use, and innovation. The second one is digital economic empowerment, promotes digital economic empowerment for citizens by equipping them with the necessary tools and skills to participate in the digital economy, creating jobs, supporting entrepreneurs, and stimulating economic growth. The last goal is digital and financial inclusion, which aims to ensure access to digital tools and basic financial services for all citizens, especially those living in underprivileged communities. حكايتنا goals contribute to several SDGs and Africa Agenda goals. حكايتنا goals also aligns with Egyptian Vision 2030, focusing on economic, social environment, and human capital development. It improves quality of life, promotes social justice, diversifies the economy, and develops infrastructure. حكايتنا targeted user super app is simply for all citizens with different categories: women, disabilities, special needs, old people, craftsmen. Really, we have a place for everyone. So now I will drop the mic to my colleague to tell us how we are doing that through our super app components.
Hello everyone, I am Muhammad Radwan, Technical Engineer in Ministry of Communication and Information Technology. First, let's watch the recorded video where we can play it while I'm describing حكايتنا Super App components. So the first component with us is the user account. The platform is accessible to all citizens regardless gender, age, education, or location, allowing users to display their education, job, and other social information. So then we have the cognitive content component, where the app provides comprehensive information about villages' history, population, demographics, and characterizations. And this data is accessible to the people inside and outside the village. It also shows historical monuments and influential public figures and village location to everyone. Third, we have an educational and training component, which focuses on developing the digital capabilities of Egyptian citizens, economic empowerment training, and promoting ICT usage for women's participation and equal opportunities to everyone. And there is a variety in the courses types offered from different authorized institutions like IPM, Microsoft, and much more. And all of these courses are totally free for everyone. Also, we have educational and awareness seminars about women empowerment, digital literacy, economic education, agriculture education, health education, social education, and much more seminars like sustainability awareness. So then we have also the marketplace component. The marketplace aims to enhance economic productivity through technological upgrades, innovation, and market expansion for local products and services. Our marketplace consists of two parts. The first part is the products part, where anyone can sell or buy products or goods. The second part is the services part, where the craftsmen like blacksmiths, plumbers, teachers can offer their services and pricing to all users through the marketplace. After that, we have the e-payment component. Our super app offers convenient and secure e-payment feature, allowing users to make transactions with ease. Also, we have a governmental services. We began to integrate with governmental platforms and authorities to facilitate access to services such as insurance, pension, medical services, and local services. Finally, we have the social communications component. It facilitates social communication among the super app. Also, it's applicable to organizations and institutions to add job offers, opportunities to trainings, meetings, requirements. Also, we're utilizing artificial intelligence in our super app. Hikayetna Super App is a smart, inclusive platform that uses artificial intelligence to deliver innovative digital solutions. It analyzes user data, build digital engagement index, adapt a platform for disabled and illiterate users, and optimize response with state and service providers for immediate interaction and urgent interventions. Now I will drop the mic back to my colleague to talk about the outcome from the super app Hikayetna.
Hello again. After we see our Hikayetna super app component, now we will highlight the outcome from this super app. The return on citizens on Egypt village, where Hikayetna super app acts as a catalyst for social and economic development in villages, delivering tangible benefits that improve lives and enhance livelihoods. It fosters connectivity, improves living standards, and drives cultural and economic growth. The app also expands market access, creates employment opportunities, and simplifies government services. On the other side, the outcome from the super app on Egypt is transforming the country by integrating digital solutions to improve rural communities. It enhances digital literacy, provides access to resource and education, promotes financial inclusion, and introduces a digital rural index to assess digital engagement. The app aims for a digitally connected, financially inclusive, and social and economic empowered Egypt. Finally, through digital innovation, we aim to build a digitally inclusive and sustainable society where no one is left behind. Thanks.
Thank you so much, Engineer Rodolfo, for that presentation on the digital decent life platform. And you'll just allow me to give a brief or a recap of the presentation. You have noted that this particular platform leverages modern ICT streamline service delivery, also to the people in the rural areas. You have noted that it aims to provide citizens, particularly in remote and undeveloped areas, with access to essential services. That's ensuring that the people in these areas get government services delivered to them. And one area that you have highlighted is that this initiative incorporates digital literacy campaigns and capacity building programs to ensure that citizens not only have access to these digital platforms, but also the skills to use them effectively. You know that in most cases, the elderly are always left behind because they cannot utilize some of these new technologies that have come in place, that have been put in place. But I think Egypt is doing great, ensuring that they give the elderly capacity building so that they're also able to learn to use these emerging technologies, thus ensuring that they are not left behind. And I think it's a good step to ensure that everyone is brought along in terms of getting accessibility to services through digital transformation. And one aspect also that has got my attention is that this particular platform has enhanced the quality of life for millions, especially in the rural areas. In most African countries, when you go to the rural areas, you'll find there's no development. People have to travel far and wide to get government services. But this has been reduced in Egypt. This one has been eliminated, and everyone is able to access government services. And eventually, healthcare has been improved, service delivery has been improved, and I think it's a good practice that can be replicated throughout the continent of Africa, because if we are all developed, every one of us, including the people in the villages, are able to get service delivery. We thank you for that presentation, and will now allow me to invite our last and final presenter, Ms. Mwangi Mwale. Let me just briefly read a brief about our presenter, and then I will invite her. She's a seasoned healthcare professional who has served as the acting customer care manager at Zambia National Healthcare Insurance Management Authority, where she has led over 150 staff in improving service efficiency. With a background in nursing, healthcare management, and strategic planning, she has contributed significantly to policy development and stakeholder engagement. She has worked on USAID-funded sexual and reproductive healthcare programs and with organizations like the Society for Family Health. Holding degrees in nursing science and public health, she is committed to enhancing healthcare delivery and ensuring quality service in Zambia healthcare insurance sector. I want to welcome you, Ms. Mwangila, for your presentation. Thank you.
Thank you very much, esteemed ladies and gentlemen, and also AAPAM for this opportunity to present at this webinar. Also presenting at the 43rd round table. It was such an honor and a pleasure. And coming out second from the beautiful innovation that is happening from Kenya was such an honor. With my presentation today, I will repeat the same presentation that we presented at the AAPAM in Kenya, because I believe this is a disruptive innovation that has brought in new technologies here in Zambia to address universal health coverage. Allow me to share my screen. Thank you very much. Implementing a responsive, customer-centric. Apologies, let me just. Okay. Implementing a responsive, customer-centric health. A case of national health insurance, which is NIMA here in Zambia. Our background stems as far as 2012, where a decision to commence a Zambia NHI had the preliminary design, which was actuarial evidence. Then in 2013, we had stakeholder consultation, which led to a draft design of the NHI bill. Consolidation of the NHI draft, which was done in 2014, and 2016, we had the review of the NHI draft. In 2017, there was a finalization of the bill and parliament-ready document done by Ministry of Justice. And then in 2017, in December, we had the first reading of the bill that was taken to Parliament. In March, on March 2nd, 2018, Parliament Committee had a second reading, and Parliament had a third reading in March in 2018. April 2018, the bill was signed into law, and the statutory instrument 63 was signed in September 2019. We can officially say NIMA was born on 1st October 2019, and last year we celebrated 5 years in existence. With this NIMA, what we have here is, first of all, the financing model, the universal health coverage, political economy, as well as health service delivery. So in the health financing bubble, we have revenues, risk pooling and purchase. This is the mandate of NIMA to collect revenues, and of course the risk and fund pooling is done by the collection of contributions from the formal and informal sector. The political economy, this is where we have the political will to have this NHI driven and implemented in Zambia. The health service delivery is offered by the healthcare providers, both private and public, to make sure that the comprehensive benefit package is met. So when you look at NIMA, from the time it was enacted into law, it came in through mandatory contributions for anybody that was formally employed. A 1% contribution from the employer and 1% contribution from the employees, making a 2% contribution on a monthly basis on the basic pay. NIMA covers a household of 7, that is the principal member, and 5 beneficiaries that are below the age of 18. In NIMA, we find solidarity, cross-subsidization, portable. NIMA is countrywide. It covers all the provinces that are in Zambia, and also comprehensive services. Our benefits package is very rich and very comprehensive, ranging from primary healthcare to treatment, and also tertiary healthcare, where we have rehabilitation. A single fund and payer strategy, strategic purchaser. Not every healthcare provider is registered or accredited under NIMA. It has to take accreditation, as well as looking at what services that are being offered. So we have the right providers being accredited for the right services. Then multiple healthcare providers, both private and public, across Zambia. The impetus for change. So when we look at the timeline that we had just in the previous slide, you could see that there was a lot of background work that was being done by parliamentarians, Ministry of Justice, Ministry of Health, and other stakeholders, and the public was not involved at that time. So the clause in information gap. So we recognized the growing demand for efficient user-centric health insurance. NIMA faced mounting pressure to disseminate information and enhance its customer service operations. There was also demand for improvement. NIMA is still under pressure to enhance its customer service, information dissemination due to long wait times, complex procedures, and limited accessibility. Need for transformation, the rise in digital technologies, you agree with me. Today, we all want something to be done at the palm of our hands. Rarely do we walk through banks. We just make transactions on our phones. And so does the NEMA want to have this technology spread to its customers. Yeah, for responsive, transparent, personalized services, highlight the urgency for NEMA to evolve. Alignment with development goals, NEMA aims always aligned with the national and continental strategies, specifically the African Union Agenda 2063 and UN 2030 Sustainable Development Goals to meet customer needs and enhance public administration. Potential for universal health coverage, NEMA's 2022 Customer Satisfaction Report indicates that universal health insurance significantly improves access to quality health care in Zambia, supporting UN SDG 3 on universal health coverage. The purpose and objective for change. Objective for change, the primary goal is to align the service delivery model with contemporary standards for efficiency, accessibility, and customer satisfaction. Enhancing customer experience, a key objective to improve customer experience by reducing waiting time, simplifying processes, and offering personalized interactions. Delivering on technology to include integrated digital solutions, streamline operations, and enhance service accessibility through online platforms and automation. Increase transparency, focus on improving transparency, accountability in accordance to the best practices in public sector engagement, promoting innovation. The initiative aimed to foster a culture of innovation to address emerging challenges. The innovation itself. NEMA has got customer service desk where our customers interact with humans or interact with NEMA personnel, the customer service agents. We have trained and deployed staff at accredited facilities to provide information to new members, hospital staff, and the public. So for private hospitals, we require that the private hospitals also just have NEMA-specific customer service agents to attend to the NEMA patients. Digital transformation, an advanced customer relation management system was implemented, integrating service channels like phone, email, social media, a unified view of customer interactions. Self-service portal, user-friendly self-service portals and mobile apps were launched, enabling customers to access insurance information, file claims, and request for assistance without visiting the offices. You'll be happy to know that for the informal sector who are not on the mandatory payroll for contributions, they're able to register their own accounts using the self-service portals. Then they're able to pay for whatever contributions they are whether owing or for future payments using the USSD codes, also online payment platforms, as opposed to walking into banks or maybe walking into NEMA offices to maybe activate their payment. Automated service processes. Automation was introduced in areas such as claim processing and customer feedback collection, expediting service delivery and reducing manual handling of claims. We are fully digitalized. All our claims are received digitally, including prior authorization for services. So with NEMA, we do not have any paper. I would say we are a paperless society, and claims are received in real time. Chatbots and virtual assistants. We have the chatbot on the NEMA website called Talk To, which is deployed to handle routine inquiries, providing instant responses and allowing agents to focus on more complex cases. Enhanced training. NEMA has invested in comprehensive continuous training to effectively utilize the tools and improve customer service. Assessment and planning. A thorough assessment of existing processes was conducted and gathering feedback from customers and staff to identify pain points and areas of improvement. With NEMA, information is our liquid gold. We started from scratch, and every little development starting from claims, customer service, and everything that we do stems from the feedback that we get. When we get a pain point, we look into it and see how can we improve this service better. Piloting and testing for continuous improvement. New systems were piloted, selected branches for performance, monitoring adjusted, followed by deployment. So we have environment, which we call the QA environment, where we test these systems before we deploy them into the live environment for use. Result achieved to date: improved customers' experience. According to the progress reports that was for July 2024, our resolution rates for complaints and queries averaged around 98%. With this level of feedback, it can be deduced that the customer experience improved. Operational efficiency, the automation of processes has led to notable reduction in manual handling and processing times, resulting to faster service deliveries. Increased accessibility, the introduction of online platforms and mobile applications made it easier for the customers to access services and information, contributing to a more inclusive and user-friendly experience. Over 40% of the population is registered. Over 9 million claims are processed. Increasing utilization is more than 300% on year to year. Enhanced transparency, the new systems have improved transparency in service delivery, with customers able to track their service requests and claims in real time. Employee empowerment, staff training, and introduction of advanced tools have empowered employees in handling customer interactions more effectively and focus on providing high quality services. Our outlook for the future: advanced analytics would like to leverage on data analytics to gain deeper insights into customer behavior, preferences, and enabling more personalized and proactive service delivery. Integration of emerging technologies, exploring the use of emerging technologies such as AI and blockchain for securing transactions and augmented realities to enhance customer experience. Expansion of digital services, continually expanding the range of digital services available through digital channels to meet evolving customer needs and preferences. Strengthening feedback mechanisms, enhancing mechanisms for collecting and analyzing customer feedbacks to drive continuous improvement and address emerging challenges. Collaborative partnerships, building partnerships with other organizations and technology providers to share best practices and leverage collective expertise in advancing customer care. Potential implication for other organizations. The key implications are detailed in turn. Model best practices for public sector. NEMA is fully a public sector organization, but our operation efficiencies could go neck to neck with the private sector because we've invested in so much technology. The success of NEMA's initiative can inspire other organizations to adopt similar innovations and foster a culture of continuous improvement and creativity. Opportunity for informed decision-making for government, for maybe other entities, as well as governments in other countries. NEMA is a change driver. Considering that NEMA has only existed for 5 years, we've made so much strides in providing a customer-centric service. Collaboration opportunities and further studies. We hope to write more about other innovations that we have embarked on through the years that can inform further studies as well as further implementation of the same in other countries or government sectors. Enablers for implementing NHIS in Africa. What does it take for you to implement such a customer-centric health insurance, national health insurance in your country? The first one is political will. The government has to be committed to prioritize universal health coverage in your country. Legislation, as you can see, NEMA came in through Ministry of Justice when actual studies were done and they made their computations, the law had to take effect. So legal frameworks for mandatory, because if you leave it out to the open for people to just come in and contribute, most people may not be willing, or they may not understand what is in it for them. Making it mandatory and making it work for them will work probably in reverse, where they'll contribute first, see the benefits, and buy in as a customer. Sustainable financing, adequate funding through taxes, member contribution, or government contributions. Infrastructure, establishment of a functional healthcare facilities. Quality improvement, provision of complete service process improvement. Public awareness, educating citizens about the benefit and responsibilities of insurance. Partnering also means collaboration with private insurers, healthcare providers, and international organizations. You'll be happy to know that we have the Global Fund that is helping pay for those members that are registered on social cash transfer, which I believe is another innovation that will be shared in the long run. It was currently piloted and it's working effectively. Capacity building, training staff, and strengthening health sector infrastructure. I can safely say I'm a member of staff that started from the scratch with NEMA, and my capacity has been built not only in understanding health insurance, but being able to contribute as a developer of this NIH in our country. Thank you very much for this opportunity and the time you've taken to listen to me. I end here with my presentation. Thank you.
Thank you so much, Ms. Manjila, for your presentation, and we want to thank you once again. Allow me just to give a brief of or a summary of what you have noted. First of all, you have noted that NEMA is in Zambia has been positioned its healthcare insurance scheme as highly customer-centric. You've noted that in practice this means that it is about pooling funds to help to bring financial health services by ensuring that every member has positive hassle-free experience when accessing healthcare. And the one key element that you have noted about NEMA is that it has invested in digital tools and effective administrative systems to simplify registration, claim submissions, and reimbursement. This has helped members obtain care quickly and minimize bureaucracy delays. You'll agree with me that in most of our countries, there is always a lot of bureaucracy, and in order to get claims reimbursed back, it normally takes a lot of time and delays, and NEMA has eliminated that. Also, there is the aspect of responsive service delivery. You noted that the scheme emphasizes 24/7 or 24 hours customer service support by having clear communication channels, mechanisms for feedback, and engaging with members through hotlines, online platforms, or even regular outreaches. So this ensures that any challenges is addressed promptly. Also, it builds trust by introducing measures such as vigorous accreditation of healthcare providers, and transparency is enhanced through this process. Another aspect of another point that you have noted is that members are kept informed about their benefits and any changes to the scheme, which fosters a sense of accountability and reliability, in that they are able to know in case things change, communication is done, and they're able to know that changes have taken place. I think you have also noted that this particular NEMA has received positive feedback from members for it being a customer-first oriented platform. And you have noted that communication is very instrumental in terms of ensuring that members know what is happening. And it has been awarded recognition and in Zambia for being responsive and member-centered platform. So we want to thank you for that, and we hope that this particular aspect can be replicated in various African countries, because that is the most important thing, to ensure that service delivery is uniform in the continent, and every country deserves to have better service delivery, because that is the most important thing. When people get service, delivered to them, they are able to appreciate their leaders more and to know that the government and the people are working for them. So we have come to the end of our webinar, and as you are aware, time is very much gone. And I want to sincerely thank each and every one of you for being there to the very end. We have surpassed our time by over 1.5 hours. So after consultations, we have agreed that we have noted down all the questions that have been posted on our chat box. All the questions have been noted. We have a number of them. We are going to, you'll kindly allow us to share these questions with our panelists later on because of time. We will not want to keep you for so long since time has already gone. So we'll skip kindly the aspect of questions and answers. We have noted them down. We are going to share them with our presenters, and they will get back to us on once they receive these questions from us. So humbly allow us to now just go to the closing remarks. And I want to invite Mr. Rajab Lukwago, who is a Ugandan public servant and young empowerment advocate, serving as Senior Assistant Secretary at the Ministry of Energy and Mineral Development. He has a background in law and public administration. He holds various leadership roles, including Vice Chairperson of the Foundation for Human Rights Initiative and President of AAPAM Young Professional Network. He is passionate about fostering youth inclusion in government, achieving the UN Sustainable Development Goal. Currently, he is developing a mentorship program to nurture emerging public service leaders, aiming to create a more engaged and capable public administration workforce in Africa. Mr. Rajab, we welcome you to give your closing remarks, and we thank you once again. I want to thank every participant for being there at the very end. Thank you very much.
Thank you so much, Clifford, for that wonderful introduction. I hope I am loud and clear. I need to make sure that that is sorted because I'm in transit.
Yes, we can hear you.
Nice. Good afternoon, ladies and gentlemen. Allow me to stand on the protocols already established. My name is Rajab Lukwago, the president of the Young Professionals Network and a committee member representing the young professionals on the AAPAM Executive Committee. It is with great pleasure that I was chosen to give the closing remarks on the topical discussion of disruptive innovations for people-centric service delivery. But before I go any further, allow me to convey my heartfelt condolences to one of our presenters, that is Kano Edith Nakalema, for having lost her beloved father, Reverend Elias Saf Serwada, which occurred on 8th of February this very year, just after the conference. May the Almighty Lord comfort you, our Kano Nakalema. I would like to also, I would also like to thank the presenters for their knowledge-rich innovations and solutions showcased, and also want to thank Julie for remembering us, the fasting community, and wishing us a blessed Ramadan. As I speak to you right now, you can see I'm on my way from Medina to Mecca on the holy pilgrimage, and I am just doing what always is done during this period. Away from that, I would like to just give a little shot on the disruptive innovations, which we need to agree that they are reshaping people-centric service delivery by making it more efficient, personalized, and accessible. Technologies like AI, blockchain, and other decentralized platforms such as gig economy like Uber, the TaskRabbit, are driving this transformation, ensuring that services are not only faster, but also more inclusive and inclusive. As organizations embrace these innovations, I believe they must prioritize human-centric design to truly enhance user experiences. The future of service delivery lies in the continuous adaptation where technology and human needs evolve together to create smarter, more responsive, and sustainable solutions. In this context, as the president of the Young Professionals, I believe the young professionals play a vital role in fostering innovations in the public sector. Their unique perspective, creativity, and tech savviness can bring fresh ideas and approaches to the traditional service delivery modules. As the next generation of leaders young professionals can drive digital transformation, they can co-create innovative solutions, they can foster a culture of innovation, they can build strategic partnerships, and I believe all this is doable right in Africa and in our countries. The benefits for these people-centric innovations are immense, and I don't want to really delve deep in them, as already highlighted. But one thing we can't, a few things that we can't skip our eyes is the improved citizen engagement, enhanced service delivery, increased transparency and accountability, better decision-making, economic growth, and competitiveness. So in the long run, people and service delivery shall align to enhance proper and adaptive service delivery. Let us just harness the energy, the creativity, and expertise of the young professionals to drive this transformation and create a better future for Africa. On replication of the winning innovations, this is so critical, and this needs to be done to ensure their sustainability and scalability. By replicating these innovations, we can extend their benefits to more communities, more regions, more countries, and ultimately leading to a wider impact. Replicating also allows us to refine and optimize these innovations. Yes, thank you all for the warm presentations, discussions, and your commitment to fostering innovative and people-centric services, service delivery. Together, we can make a better Africa. With those few remarks, I declare this webinar closed. Thank you so much, and thank you. Have a good afternoon.